nature of man. It's the earth man. Rasta man. I listen to the first.
What is a Rasta man? The man we set the plan. The man we touch the street and love and bless up everyone. The Rasta man no skip a beat. The Rasta man unique. We not go take defeat. The mission not be complete. And through the humble and the meek. can't get you out my mind. Spend with you. I'm so sorry that I broke your heart to pieces.
The Committee on Mental Health, the Committee on Health, Hospital, and Human Services is now in order. I'd like to start by giving thanks and praises to the Most High, and good morning to all of my esteemed colleagues and all of the invited testifiers, and also a pleasant good morning to the listening audience, all those watching on TV. Blessings, blessings, blessings. The committee has been working for months to put this day together, and we're so pleased that we're finally able to assemble this esteemed group of professionals in our community to give testimony on the state of behavioral health. Substance abuse and alcoholism is also involved. Last month, May was Mental Health Awareness Month, and June is Men's Mental Health Awareness Month. And I think it's important for us to start this day stressing the need to end the stigma. That's right, the stigma associated with behavioral health illness. And we've all seen this stigma, and this behavioral health stigma can prevent individuals from seeking help or openly discussing their struggles. Our mental health stigma presents a significant barrier to persons with behavioral health illness in getting help. And the community's reluctance, that's right, to acknowledge behavioral health challenges can perpetrate a cycle of silence and isolation, which further exacerbates the impact of mental health challenges on individuals and their families. We collectively need to foster a culture of understanding, compassion, and acceptance so persons with behavioral health issues can feel empowered to seek support without fear of stigma or discrimination. And today, this committee will have a general discussion, receive testimony from the various government and private sector organizations, and present other resources available to support persons with behavioral health issues and concerned family members and friends. Whatever behavioral health challenges you are facing, there is help. You can call the Behavioral Health Hotline, the 988 hotline. You can call it now, and there's assistance. Back in 2019, the Honorable Governor Albert Bryan declared a mental health emergency in the territory, as we remember the grave impacts that our community faced after Hurricanes Irma and Maria. According to the Community Health Assessment published in May 2020 by the USVI Department of Health, male suicides within the territory have risen by 351% since 2005. That's right, 351%. The Community Health Needs Assessment conducted by the St. Thomas Eastern Medical Center in 2020 identified that over 50% of adults they surveyed could be classified as having depressive symptoms, and more than 35% of high school students surveyed reported in the last 12 months that they felt so sad and hopeless every day for 2 or more weeks that they stopped doing their usual activities. And over 20% of middle schoolers said they had seriously contemplated suicide. That's right. We have people in our community are contemplating suicide. Today, we all gather to address the behavioral health issues that has been plaguing our community. We also express that alcoholism, substance abuse, and homelessness are all closely associated with behavioral health issues. We have invited a plethora of experts from within our community to provide insight into what exactly the challenges now facing our community and how to best address this issue head on. Our aim today is to have a frank discussion leading toward solutions for behavioral health, substance abuse, alcoholism issues. Thank you, thank you, thank you. Madam Clerk, please call the roll.
Senator Marvin A. Blyden.
Present.
Senator Marvin Blyden, present. Senator Diane T. Capehart.
Present.
Senator Diane T. Capehart, present. Senator Samuel Carrion. Senator Carrion, absent. Senator Ray Fonseca.
I'm here.
Senator Ray Fonseca, present. Senator Novell E. Francis Jr. Senator Novell E. Francis Jr. Senator Novell E. Francis Jr. absent.
No, he's present. Present.
Present? Okay. Senator Donna A. Fred Gregory. Senator Donna A. Fred Gregory, absent. Senator Kenneth L. Gittens. Senator Kenneth L. Gittens, absent. Senator Maurice C. James.
Here.
Senator Maurice C. James, present. Senator Milton E. Potter.
Here.
Senator Milton E. Potter, present. Senator, you have 6 present, 3 absent.
Thank you, Madam Clerk. We have a quorum. Madam Clerk, please read Block 1 into the agenda. Oh, excuse me, Madam Clerk, do we have any excuse letters to be read into the record?
Yes, Mr. Chair.
Please proceed.
Honorable Ray Fonseca, Chairperson, Committee on Health, Hospitals, and Human Services, 35th Legislature of the Virgin Islands, Capitol Building, St. Thomas, U.S. Virgin Islands. Late arrival to Committee on Health, Hospitals, and Human Services. Dear Chairperson Fonseca, please accept this letter as a formal notice of my late arrival to today's Committee on Health, Hospitals, and Human Services meeting, which is scheduled to begin at 10 a.m. in the Earl B. Otley Legislative Hall in St. Thomas. Please have all circulated documents placed on my desk for immediate review upon my arrival. Thank you for your consideration on this matter. Kindest regards, Senator Donna Fred Gregory, Chair, Committee on Budget, Appropriations, and Finance. Honorable Ray Fonseca, Committee on Health, Hospitals, and Human Services, 35th Legislature of the Virgin Islands, Capitol Building, Charlotte Amalie, St. Thomas, Virgin Islands, 00804. Their Chairman Fonseca. I'm writing to formally apologize for my absence from the beginning of today's Committee on Health, Hospitals, and Human Services meeting. Unfortunately, I had a prior engagement that overlapped with the scheduled start time. I look forward to actively participating upon my arrival. Thank you for your understanding and consideration in this matter. Sincerely, Senator Samuel Carrion, Senator 35th Legislature of the Virgin Islands. The end of the reading of the excuse letters.
Thank you, Madam Clerk. Please mark Senator Donna Fred Gregory and Senator Samuel Carrion as excused. Can you give me an update on the roll call, Madam Clerk?
You have 6 present and 2 excused, 1 absent.
Thank you. We have a quorum. I'd like to acknowledge the presence of non-committee member, our Honorable Senator Carla Joseph, Madam Secretary. Thanks for being here today.
Thank you for welcoming me.
Thank you. Madam Clerk, can you read Block 1 into the record?
Block 1, Bill number 35-0224, an act amending Title 19, Part 5, Chapter 45, Subchapter 6, to increase access to behavioral health services with a focus on a psychiatric emergency response team to provide mobile crisis intervention services, and the 988 telecommunications system, sponsored by Senator Diane T. Capehart.
Thank you, Madam Clerk. Who speaks to this bill? Senator Diane Capehart, you're recognized.
Thank you.
Media recognize the mic for Senator Capehart.
Thank you, Mr. Chair. First, I would like to say blessed good morning to my colleagues, legislative staff, to the testifiers, and to the people of the Virgin Islands, those who are viewing and listening. Good morning. This bill, number 35-0224, has already been talked about in this committee, has been vetted in this committee. It just so happened on the day that it was being vetted and amendments being worked on, we had to close the legislature due to weather. So thank you, Mr. Chair, for bringing this bill, as I know that your agenda is very heavy today, dealing with this same issue, that this bill actually addresses our behavioral challenges. This is like the infrastructure that we need to start to address the challenges that we face in the Virgin Islands. The Psychiatric Emergency Response Bill is PERT, and it's basically a mobile crisis intervention and multidisciplinary behavioral health team as defined in the American Rescue Act of 2021 that provides an acute behavioral health crisis outreach and receiving and stabilization services by directly responding to 988 National Suicide Prevention and Behavioral Crisis Hotline. Senators, this is just a specialized trained unit of individuals that when 988 is called, that this unit is the first responders. We already heard from Department of Health, we heard from Vitima, and the amendment that is before us today, I have taken those considerations and amended that bill. This bill also must meet national suicide prevention lifeline requirements and best practices guidelines for operational performances, clinical standards. They must provide data and report. I'm just going to get a little personal as I think about this bill. Jesse Martinez would have been happy for this bill when he was having a behavioral episode in the town of Frederickstead. Individuals that I can't call their names on St. Thomas who may have been crying out for help, they could have been probably assisted with PERT. So colleagues, let's start working on the infrastructure to improve the quality of life for individuals who are having a dark time in their life. That when you call 911, 988, that the people that are responding to them know how to deal with them. So I say, colleagues, as I said, this has been vetted in committee, and I ask for your vote. I ask for your support. Thank you, Mr. Chair.
Thank you, Senator Capehart.
I'm ready to entertain
Amendment, do I hear amendment?
Yes.
Yes, you're recognized, Senator Capehart.
Thank you, Mr. Chair. I offer amendment number 35-654 to bill number 35-024, and it reads as followed, offered by Senator Diane Capehart. Bill number 35-0224 is amended by striking the language after the enabling clause and inserting new language that reads as follows. Section 1, Title 19 Virgin Islands Code, Part 5, Chapter 45 is amended as follows. Section A, Section 1001 is amended by adding the following definitions. 1, 988 means the universal telephone number for the National Suicide Prevention and Mental Health Crisis Hotline within the United States, operating through the National Suicide Prevention Lifeline or its successor, and maintained by the Assistant Secretary for Mental Health and Substance Use under Section 520E.
Senator Marvin Blyden, you're recognized for your motion.
Thank you, Mr. Chair. Mr. Chair, move to waive the reading of amendment number 35-654. I so move.
It's been properly moved and second to waive the reading of Amendment 35-654 to Bill number 350224. Any objections? Hearing no objections, so ordered. So, Senator Capehart, you're recognized for your motion.
Mr. Chair, I move that Bill number 35-0224 as amended, an act amending Title 19, Part 5, Chapter 45, Subchapter 6, to increase access to behavioral health services with a focus on psychiatric emergency response team to provide mobile crisis intervention services and the 988 telecommunication systems be forwarded to the Committee of Rules and Judiciary for further consideration. I so move.
Second.
It's been properly moved and second.
Roll call.
It's been properly moved and second by Senator Capehart and seconded by Senator Marvin Blyden. Roll call.
Senator Marvin A. Blyden.
Yes.
Senator Marvin Blyden, yay. Senator Diane A. Capehart.
Yes.
Senator Diane A. Capehart, yay. Senator Samuel Carrion, absent. Senator Ray Fonseca.
Yea.
Senator Ray Fonseca, yay. Senator Novell E. Francis Jr. Senator Novell E. Francis Jr. absent. Senator Donna A. Fred Gregory, absent. Senator Kenneth L. Gittens, absent. Senator Maurice C. James.
Yes.
Senator Maurice C. James, yay. Senator Milton E. Potter.
Yes.
Senator Milton E. Potter, yay. You have 5 yay, 4 absent.
Thank you, Madam Clerk. Bill number 35-0224 as amended, an act amending Title 19, Part 5, Chapter 45, Subchapter 6 to increase access to behavioral health services with a focus on a psychiatric emergency response team to provide mobile crisis intervention services and the 988 telecommunication system has been favorably voted on by this committee and will be forward to the Committee on Rules and Judiciary for further action. So moved. Madam Clerk, can you please read Block 2 into the agenda?
Mr. Point of personal privilege.
Senator Caput, you're recognized for a point of personal privilege.
Thank you, Mr. Chair. I just want to say thank you to my colleagues for voting. This is a very important legislation that we've just voted on. I have been working on this bill, talking to individuals in this community, the experts from PD, health, human services, and these individuals have actually provided information that was actually provided in this amendment today. So colleagues, I just want to say thank you as we champion today addressing behavioral challenges in the Virgin Islands. Thank you, Mr. Chair.
Thank you, Senator Caput, and I too want to echo the importance of this bill, because a lot of the times when there's an emergency issue and a call is made, normally VIPD is not the first person that is the best to respond. So with this mobile response team, this would be a great move in the right direction for the community. Thank you. Madam Clerk, can you read Block 2 into the agenda?
Block 2, the committee will receive testimony on the status of behavioral health, substance abuse from the departments, agencies, and organizations perspective here in the territory. Testimony should include, in part, the frequency and types of interaction with persons perceived to have mental disabilities. Invited testifiers, the Honorable Ray A. Martinez, Commissioner, Virgin Islands Police Department, the Honorable Avril E. George, Commissioner, Department of Human Services, the Honorable Justice Tita E. Encarnacion, Commissioner, Department of Health, the Honorable Dion Wells Hedrington, Commissioner, Department of Education, Ms. Winnie Testemark, Director, Bureau of Corrections, Ms. Tina M. Communication, Chief Executive Officer, Snyder Regional Medical Center, Mr. Doug Kutch, Chief Executive Officer, Governor Wang F. Louis Hospital and Medical Center, Ms. Ray Sproul Webster, Chief Executive Officer, Frederiksted Healthcare, Tess G. Richards, Executive Director, St. Thomas East End Medical Center Corp., Mr. Troy A. D. Schuster, State Director, AARP of the Virgin Islands, Dr. Lori McCormick, Founder, Holistic Wellness and Psychiatry, Dr. Denise Marshall, Licensed Clinical Psychologist, Mrs. Andrea Schilling-Ford, Executive Director, Catholic Charities of the Virgin Islands, Ms. D. Beecher Brown, President, Community Foundation of the Virgin Islands, Mr. Daniel DeRima, Executive Director, Methodist Training and Outreach Center, Ms. Anya Stewart, Executive Director, Family Resource Center, Inc., Ms. Junia John Straker, Chief Executive Officer, Lutheran Social Services, Ms. Lily Cox, Director, Communications and Community Investments, St. Croix Foundation, Dr. Clemma Lewis, Executive Director, Women's Coalition of St. Croix, Darren Torres Hairston, Director, Clinical Social Worker, Nana Baby Children's Home. End of the reading of Block 2, Mr. Chair.
Thank you, Madam Clerk. And once again, I want to say a special welcome to all the testifiers. We had a little housekeeping matter that we had to take care of before we receive your testimony. And special welcome. I wanted to start with a mic check on St. Croix, and also to anyone that is connected by Teams or Zoom. So St. Croix, if you can just start and give your name and the organization or position, and then we'll proceed from my left to my right, to right.
Good morning, Ms. Ira Sproul Webster, Frederiksted Healthcare.
Good morning. Ruben Malloy, Assistant Commissioner, Virgin Islands Department of Health.
Good morning, Avril George, Commissioner of Department of Human Services.
Good morning, Doug Cook, Chief Executive Officer, Governor Juan F. Louis Hospital.
Morning, Doris Plaskett, Chief Nursing Officer, Governor Juan F. Louis Hospital.
Good morning, Dr. Clemma Lewis, Women's Coalition of St. Croix.
I don't have a copy of that.
Good morning, Shalene Gums, Director of Intervention Services, Women's Coalition of St. Croix.
You need a copy.
Good morning, Dr. Tanya Lockhart, Division of Special Education District Director.
Morning, Giselle Shang, Social Emotional Wellness Program Manager, St. Croix District.
Thank
Department
you.
of Education.
If we can now go to the teams, is there anyone connected on the teams?
Good morning, everyone. This is Commissioner Justa Encarnacion from the Virgin Islands Department of Health. Thank you.
Good morning. This is Lily Cox, Director of Communications and Community Investments at St. Croix Foundation.
Good morning. Good morning. Deanna James, St. Croix Foundation CEO.
Good morning, Alex Barron, Headless of the Elder Shaldebron Facility for the Mentally Ill.
Okay, thank you. And we will now receive the names and your position, the organization from St. Thomas. Start with you, Deputy Commissioner.
Good morning. Good morning, Renan Steele, Deputy Commissioner, Virgin Islands Department of Health.
Good morning, Nicole Cragwell-Sims, Assistant Commissioner, Department of Health.
Pleasant good morning, Tina Comisiong, Chief Executive Officer, Schneider Regional Medical Center.
Good morning, Ania Stiot, Family Resource Center, Executive Director.
Good morning, Dr. Lori McCormick, I'm board certified psychiatrist and owner of Holistic Wellness and Psychiatry.
Good morning, Victor Som III, Assistant Commissioner of Education.
Good morning, Dr. Stefan Yergin, Insular Superintendent, St. Thomas St. John School District.
Good morning, Karen Chancellor, Acting Deputy Superintendent, Virgin Islands Department of Education, St. Croix District.
Good morning, Rona Pini-Simon, Director Student Services, St. Thomas St. John District, Virgin Islands Department of Education.
Good morning, Giselle Ramos, Acting Director of Behavioral Health, Department of Health.
Good morning, Paulette Van Zen Potter, Behavioral Health Operations Manager at St. Thomas Eastern Medical Center. Thank you.
Thank you, and blessings and good morning to all. Okay, so we are going, since we have, such a list of distinguished testifiers, what we're going to do is we're going to start with the Honorable Justa Encarnacion, and then we're going to go to Avril George from Human Services, and then we're going to start, we're going to go to Education, and who is representing Commissioner Dion Wells-Hendrington. And then after those three, then we'll go with the testimony on St. Croix, and then we'll come back and finish with the testimony on St. Thomas. So we're going to start with Commissioner of Health, then Human Services, then Education, then we'll go to St. Croix. So welcome again, and Commissioner Justa Encarnacion, you may proceed.
Thank you, Senator. Actually, Dr. Nicole Cragwell-Sims is going to read the testimony as she is President of the Legislature today. Thank you very much. Dr. Sims?
Assistant Commissioner Sims, you may proceed.
Thank you. Good day, Honorable Senator Ray Fonseca, Chairperson of the Committee on Health, Hospitals, and Human Services, Honorable Kenneth L. Gittins, Vice Chair, committee members, and all non-committee members, and the viewing and listening audience. I am Dr. Nicole Cragwell-Sims, Assistant Commissioner for the Virgin Islands Department of Health, and I'm in attendance today on behalf of Commissioner Encarnacion, who is visible but cannot be here in person, and sends her regards. Commissioner Encarnacion and her team have rallied here today. Present with me today on St. Thomas and St. Croix, respectively, are Ruben Malloy, Assistant Commissioner, Renan Steele, Deputy Commissioner, Giselle Ramos, Acting Director of Behavioral Health Division, and other members of our executive and behavioral health team in the audience. As we close out Mental Health Awareness Month, we commend and highlight the hard work of our behavioral health and maternal and child health teams, as well as our sister agencies here with us today, and all committee-based partners with a keen focus on behavioral health. The Behavioral Health Division provides psychiatric services, case management, therapeutic interventions, substance use treatment, opioid treatment programs, forensic and outreach services. The division's outpatient team includes 2 part-time psychiatrists, 8 counselors, 3 case managers, 2 newly onboarded case managers as of the first week of May, 3 clinical staff members, an opioid project director, and additional support staff. The division is actively pursuing grant funding to expand psychiatric services. Notably, we have successfully onboarded a psychiatrist who hails from the territory, demonstrating a commitment to addressing the critical need for psychiatric services in a culturally sensitive manner. Our overall efforts are aimed at building capacity. However, a trained workforce continues to be a need for the Behavioral Health Division. In a proactive approach to critical intervention, the division continues to train law enforcement and other agencies in nonviolent crisis intervention, or CPI, equipping them with the necessary skills to de-escalate individuals in crisis. The Behavioral Health Division has also initiated recruitment efforts for crisis response specialists with the responsibility of ensuring timely and effective crisis intervention. The Behavioral Health leadership recently returned from a Substance Abuse Mental Health Service Administration, or SAMHSA, 988 National Conference to continue the implementation of the 988 Crisis and Suicide Lifeline in the territory. The Lifeline provides free and confidential emotional support to persons in suicidal crisis or emotional distress 24 hours a day, 7 days a week in the United States. By simply calling or texting the Lifeline, individuals will be connected to a behavioral health professional and can engage in confidential conversation. The Behavioral Health Division is working with SAMHSA and Vibrant, a nonprofit crisis support organization, to become a certified 988 call center so that calls, texts, and chat to the Lifeline will be answered locally rather than nationally. Additionally, the division is collaborating with the Veterans Affairs Office, the 988 Press 1 number, to ensure that veterans receive specialized support tailored to their unique needs. Our federal partners have set a requirement that the local 988 Suicide and Crisis Lifeline project must be fully implemented by July of 2025. In coordination with the Division of Personnel, job descriptions have been approved and interviews have been conducted. Our goal is to begin onboarding by the 4th quarter of this year. The completion of this lifeline will enhance our community's ability to respond effectively to behavioral health emergencies and provide timely support to those in need. The National 988 Lifeline received 492 calls that originated from the territory between November of 2023 and March of 2024. Our department actively engages in community outreach programs to promote behavioral health awareness, education, and early intervention for behavioral health and substance use disorder. Between April of 2023 and April of 2024, there have been 22,033 behavioral health outreach encounters, and 2,045 patients visited our clinics during the same time period. These efforts include providing information on available resources, facilitating support groups, and conducting outreach activities for underserved populations within our community. Through 2023 and 24, we have addressed the following topics in various settings, including schools, universities, government agencies, Rotary clubs, and professional development sessions for school monitors. These sessions covered topics such as mental health, mental wellness, and the risky behavior and bullying, substance use, 988 services, social and emotional wellness, and grief counseling, and establishing the Feelings Friday. Our outreach efforts within the school system are exemplified by the St. Croix Educational Complex's invitation for us to hold 6 to 8 week open group sessions. Initially designed for students struggling academically due to loss, the positive feedback led to requests for more sessions, showcasing the students' appreciation for the safe environment provided. Subsequent collaborations, such as participation in behavioral health outreach with the John H. Woodson Science Honor Society, further extended our impact. Additionally, an Arch Institute, Inc. initiative named Feeling Friday, as previously mentioned, introduced self-care and coping skills to high school students across the territory, garnishing interest and engagement from participants. These efforts culminated in a successful event hosted by the St. Croix Rotary Club, emphasizing the growing reach and influence of our program. On June 4, 2024, a comprehensive training session was conducted on the island of St. Thomas for 77 school monitors. This training focused on enhancing their understanding of behavioral health, emotional wellness, and effective coping strategies. This initiative underscores our commitment to fostering a harmonious collaboration between the Virgin Islands Department of Education and the Department of Health, specifically BHU. Furthermore, we commit to continuing this effort throughout the summer and into the upcoming school year. At present, the Elder Shelterbrand residential facility accommodates 25 residents, comprising 12 males and 13 females. The facility serves as a structured and supportive environment tailored for individuals in need of continuous treatment and support for behavioral health challenges. Services provided encompass therapy, medication management, life skills training, and assistance with daily activities. Moreover, the facility benefits from the kindness of volunteers and community stakeholders who generously contribute tangible items or their time to support and spend time with the residents. The overarching objective is to assist residents in stabilizing their mental health, cultivating coping mechanisms, and processing towards recovery within a secure and monitored environment. We would like to take the time to publicly thank each member of our dynamic ESF staff. Your dedication is unmatched. Currently, 48 USVI residents, 22 NGRIs or not guilty by reason of insanity, 15 chronic care, and 11 intellectually disabled are receiving essential acute care in various off-island facilities. We have 2 pending transfers off-island, and 1 is set to be transferred into Elder Shelterbrand facility in June of 2024. Often mandated by court orders, these patients require intensive services to address their acute mental health diagnoses, highlighting the increasing demand for specialized care for those facing severe mental health challenges. The division oversees all off-island residents, provides care management services, participates in all treatment team meetings, and remains responsive 24/7. As a legal guardian in collaboration with the behavioral health team, the Commissioner of Health approves changes to their plans, including medication management. This dedication to specialized care underscores our commitment to prioritizing the well-being and recovery of every individual in our community. Though targeted interventions and support we strive to empower individuals to overcome acute mental health challenges and regain stability in their lives. While off-island care addresses immediate need, our long-term goal is to construct and implement a facility within a territory. A task order has been issued for Springline Architects, and we have held several productive design development meetings that have yielded 4 conceptual designs. Each design offers and includes acute transition, care, adolescent, detox, and forensic services to ensure our vision of establishing an accredited facility becomes a reality. Design development meetings are ongoing. The Behavioral Health Act 8688, sponsored by Senator Novell Francis Jr., approved by the 34th Legislature and by Governor Albert Bryan Jr. as part of his Healthier Horizons initiative, demonstrates our government's strong commitment to addressing behavioral health challenges systematically. As mandated by Act 8688, the establishment of the Interdepartmental Coordinating Committee marks a significant shift in our approach, fostering collaboration and coordination across various governmental entities. The Interdepartmental Coordinating Committee brings together key stakeholders such as the Health, Education, Human Services, and Police Commissioners, the Vocational Rehabilitation Director, the Chair of the Virgin Islands Health and Hospitals Facilities Corp., along with representatives from our federally qualified health centers and nonprofit organizations like NAMI. Additionally, the committee benefits from the valuable input of the division's nurse, whose extensive insight contributes to understanding daily operations and areas for enhancement. Holding monthly meetings, the committee engages in strategic planning and acts as a critical platform for coordinating and exchanging information regarding behavioral health initiatives in our community. Our most recent meeting took place in May 2024. Serving as a permanent liaison Among the departments involved, the committee ensures cohesive efforts in addressing behavioral health challenges. The primary goal of the committee is to develop a comprehensive work plan that keeps participants focused, defines clear objectives, and remains on target to satisfy those objectives. Moreover, the creation of this committee acknowledges behavioral health as a cross-cutting issue that intercepts with the various facets of public policy and governance. By working together across department and agencies, we can break down barriers, streamline resources, and ensure that every individual receives the care and support they need. Our education system plays a vital role in identifying and supporting students with behavioral health challenges. Our department collaborates with educational institutions to develop and implement strategies for creating mentally healthy learning environments. Interactions in this context include training for educators, counseling services for students and staff, and crisis response protocols. We must publicly commend the Virgin Islands Department, the Virgin Islands Police Department, and VI Fire and EMS teams for always helping us provide collaborative, emergent behavioral health intervention to the community. That collaboration will continue more formally with the full implementation of the Crisis Intervention Team. We have provided crisis intervention training to law enforcement officers and peace officers. The next training will be held and scheduled for June 20th, 21st of 2024. The Virgin Islands Department of Health takes responsibility for individuals under the court system. During the period of January to April 2024, the Behavioral Health Division's clinical therapist, case managers, psychiatrists, and the Deputy Commissioner collectively participated in 90 court proceedings. The team's clinical assessments aid in informed decision-making, potentially resulting in the individual being declared not guilty by reason of insanity or an NGRI. Through partnerships with the Bureau of Corrections, or BOC, and private transport companies, the department facilitates transportation requests, ensuring safe journeys to off-island treatment facilities or court appearances. While legal processes are ongoing, the department retains custody, overseeing administrative duties like record keeping and adherence to court mandates. The partnership between DOH and BOC improves resource allocation and elevates care for court-ordered patients, emphasizing streamlined coordination to effectively address the requirements. Additionally, DOH assumes financial obligations for these transports, covering costs for vendors like JAD services, which typically amounts to $14,000 to $16,000 per trip for 2 patients and officers. The Behavioral Health Division also funds expenses for local officers with an average cost of approximately $6,794 per trip, encompassing per diems, flights, and transportation to and from off-island facilities. Over the period of January to April, a total of 4 trips with local officers at $27,176 and 2 trips for JAD services requests at $30,000 incurred a combined expense of $57,176 for transporting 6 patients. The Department of Health has provided a gap analysis which is attached. Critical funding needed and resources. The department requires additional funding to fully back the crisis response team and has applied for supplemental federal HRSA funds to bolster the program, potentially accelerating implementation timeline upon approval. Ensuring round-the-clock access to a comprehensive crisis continuum for all, irrespective of financial constraints, is critical in delivering prompt and efficient interventions to individuals in behavioral health crisis. Enclosed with the testimony is a funding breakdown chart outlining the $1.8 million annually needed for personnel and fringe expenses to establish and maintain a robust 24/7 CRT, or crisis intervention program. In conclusion, as we strive for process and progress in the behavioral health services within the Virgin Islands of the United States, we emphasize our dedication to collaboration, innovation, and ensuring essential funding to propel these vital services forward. Our unwavering commitment to diminishing health risk, enhancing healthcare abilities, and upholding stringent health standards remain steadfast. The Virgin Islands Department of Health pledges ongoing collaboration with the members of the 35th Legislature, standing prepared to address any inquiries and work collectively towards a healthier and more supported community. Thank you.
Thank you so much, Assistant Commissioner Sims. Next, we're going to have Commissioner, and congratulations again, Commissioner Alfred George from the Department of Human Services. You may proceed with your testimony, Commissioner.
Thank you very much. Good morning, Honorable Ray Fonseca, Chair of the Committee on Health, Hospital and Human Services, committee members, and other senators present, and the listening and viewing audience. I am Avril E. George, Commissioner for the Virgin Islands Department of Human Services. I come before you today to provide insight into the status of mental health in our territory from my department's perspective. When we attempt to dialogue about mental health, our intent is to often talk about the mental wellness of individuals. Mental wellness is a facet of life that is navigated by every one of us, every day of our lives. We often do not think about mental wellness until situation arises in our personal lives, at work, in the news, on social media, or in the community where the mental wellness of individuals come into question. At those times, conversations about mental health and mental illness start to trend upwards. The apparent proliferation of cases of individuals with mental illness in the territory, of visibly homeless persons sleeping and living in open spaces that are assumed to have mental illnesses, of persons walking in the streets unkept, disheveled and demonstrating behaviors that appear abnormal or concerning are all indicative of the breadth of the issues individuals experience. This may be attributed to varying degrees of symptoms relative to the behavioral health diagnosis. The notable challenges presented because of mental illness do not only affect the individuals experiencing the illnesses, but also their children, families, friends, neighbors, and the community. The DHS mandate and focus are to provide social services that facilitate independence and self-sufficiency in the lives of vulnerable individuals in our community, especially those who require an elevated level of support. However, these are the same clients that also need the other services provided by DHS. At times, the diagnosed individuals need the services, and at other times, their children and other family members need DHS and other agencies' intervention to responsibly manage the impact of mental illness on various areas of their lives. When faced with clients that appear to be experiencing behavioral health challenges, our programs refer for assessment, evaluation, and services. Depending on the client's situation, referrals are made to the Virgin Islands Department of Health, Division of Behavioral Health, Alcoholism, and Drug Dependency Services, or private agencies and providers via individual provider agreements and via the Medical Assistance Program, MAP or Medicaid. In acute situations, we advise families to take their loved ones to the hospital for commitment, diagnosis, and stabilization. Some of the most challenging situations occur when persons who are suffering from a mental illness refuse to undergo evaluation and treatment services. As adults, they have a right to deny services. We must respect those rights within the law while ensuring that their choices, which might be impaired, do not result in harm to others. The department collaborates with DOH to ensure that staff from both agencies that work with the same clients are knowledgeable about the services being provided and service gaps. As you are aware, the illness itself is what is referred to when people reference mental health, but the mental health and the behaviors and resulting effects that go along with that is referred to as behavioral health. The behaviors associated with impaired behavioral health occur on a continuum. Some behaviors, while obviously what would be considered normal, present no health risk to themselves or others. These persons fully retain their rights as parents and as people. Often the department is left with no recourse other than to refer them for evaluation and treatment and closely monitor after engaging in advocacy and referral services. When DHS involvement is limited to brief or non-treatment services, such as financial benefits and medical insurance to meet their immediate needs, staff provide support by assisting family members with completing housing applications, assisting when possible with referrals for homeless sheltering, facilitating the application process for SNAP, cash assistance, Medicaid coverage, emergency maintenance services, and support to children, families, and our beloved seniors. We also have developmentally disabled children who fall under the behavioral health category prior to being fully assessed. DHS makes referral to DOE and has off-island placements when necessary. We are mindful that the responsibility for serving those that live with mental illness and the effects on the community cannot solely rest upon one department's shoulders. We currently meet to consistently activate multi-sector coalitions, such as the Interdepartmental Coordinating Committee, in the planning and implementation of behavioral health services. Behavioral health concerns must remain a foremost priority in our territory. Accordingly, the Department of Human Services remain committed to joining forces with every entity, in addition to DOH, to improve the health and well-being of the people of these Virgin Islands. As I conclude this testimony, I'm very appreciative of my executive branch colleagues, members of the legislative body, Governor Albert Bryan Jr., and Lieutenant Governor Tregenza Roach. We at DHS will continue to live out our commitment to working together to make a difference for the people of these Virgin Islands. Thank you.
Thank you, Commissioner George. Human Services. Next, we'll receive a testimony from Education.
Good morning. Good morning to the Honorable Ray Fonseca, Chairman of the Health, Hospitals, and Human Services Committee, other committee members, and members of the 35th Legislature, other testifiers, and my fellow Virgin Islanders. Testifying on behalf of the Honorable Dion Wells Hendrington, Commissioner of Education. I am Victor Sum III, Assistant Commissioner of Education. Joining me to also provide testimony today on mental health from the Virgin Islands Department of Education's perspective, to include in part the frequency and type of interactions with persons perceived to have mental disabilities, and the value of the comprehensive data being assembled to better understand and address a persistent social disorder plaguing our community, are the following individuals. Dr. Stephen V. Jorgen, Institute Superintendent for the St. Thomas St. John District. Ms. Karen Chancellor, the Acting Deputy Superintendent for the St. Croix District. Dr. Tanya Lockhart, the District Director of the Division of Special Education for the St. Croix District. Mrs. Rona Pinney-Simon, the District Director for Student Services for the St. Thomas St. John District. And Ms. Giselle Shang, the Social Emotional Wellness Program Manager on the St. Croix District. The Virgin Islands Department of Education fully supports promoting mental health education and awareness, as it is beneficial to our students' social and emotional learning. The department plays a pivotal role in increasing students' and community awareness about mental health, as awareness through education is the first step to reduce the stigma attached to mental illness. Mental illness is generally misunderstood, but we are all, at one point or another, faces of mental stress. While we may not be the homeless person walking the streets of Frederickstead, Savannah, or the Frank-Paul Park in Cruz Bay, we are the ones who live with depression, schizophrenia, bipolar disorder, obsessive-compulsive disorder, or anxiety every day as we go about the business of living a normal life. That is until something triggers an episode. Then we are faced with the true reality of the mental health crisis in the Virgin Islands. Presently, the department interacts daily with public and private therapeutic institutions in providing a wraparound standard of care for students with issues related to mental wellness. The Safe and Healthy Students Program, formerly the Alternative Education Program on St. Croix, the Edith Williams Alternative Academy, or EWA, and the Youth Rehabilitation Center provide these services to assigned students as identified by their school teams or the court system. Our school counselors play a very critical and integral role in providing support and referral for students. For students with disabilities who demonstrate the need for mental health assistance, the Division of Special Education in both districts provides individualized counseling to students. The area of mental health, although not an area categorized by the Individuals with Disabilities Education Act, or IDEA, under special education, whereby individualized special services are rendered. However, IDEA does recognize students with emotional disorders, or ED. When mental health services become necessary outside the scope of what special education can offer, assistance is sought either publicly or privately to cater to the individualized needs of students. As such, even though one may hypothesize that a specific type of disability may be predisposed to require mental health services, mental health crises do not discriminate. All disability categories can be affected.
Can you recognize the mic at Senator Bowker's desk?
Good morning. Karen Chancellor for the St. Croix District. Mental health and wellness services to students in the St. Croix District. Schools in the St. Croix District play the most important role in providing a comprehensive learning support system for students. A major component of the learning support system is the emotional well-being and mental health services to students. The school-based support services for students include school counselors providing academic, social, emotional, and career development supports. School counselors focus peer support, academic counseling, and guidance and referrals. The district's counseling program is based on the comprehensive research-based American School Counselor Association, otherwise known as ASCA, national model, which details the knowledge and skills needed for the achievement of academic success, social emotional development, and college career readiness for students. In collaboration with teachers, nurses, and other educational professionals, school counselors work towards creating a positive social environment promoting healthy living, learning, and personal growth for all students. Under this domain, students frequently receive direct counseling services to help them manage their emotions and apply their interpersonal skills between their peers or adults. Partnerships with home, community, government, not-for-profit, and private organizations are essential and a required component of providing a strong support system. Established partnerships provide a clear roadmap for communication, delineating roles and outlining processes and available resources and services. Regular engagement of community mental health partners and families lends for a family-centered system of approach that augments the support services and promotes positive well-being in schools. Based on the ASCA model for social emotional support, school counselors utilize the multi-tiered system of supports that centers on awareness, prevention, and to identify and address mental health issues in school. Please note that school counselors provide daily intervention services and not mental health counseling. Mental health activities are provided by trained mental health clinicians. Tier 1, supports provided to all students. These address the universal social and emotional needs of all students. School counselors guide daily individual and group sessions and classroom presentations, daily individual group sessions with community-based organizations, daily and consistent contact with students, facilitate the grieving and healing processes. provide clear communication of behavioral expectations in the areas of citizenship, respect, responsibility, honesty, fairness, integrity, etc. Monitor learning support services and reinforce activities based on the 5 competencies of social and emotional learning, which are self-awareness, self-management, relationship skills, responsible decision-making. Social awareness. Tier 2, supports provided for mental wellness. Individual and group check-ins with the school counselor focusing on managing behaviors, grieving, self-awareness, domestic and gun violence, coping skills, etc. Daily individual meetings with the school counselor regarding academic achievement, performance, and student success and intervention plans. Progress monitoring of students, plans for behavior management, interventions employed, restorative justice, and targeted support activities. Referral of students to health clinicians for screening and identification of mental health concerns. Individual and group sessions addressing behavioral health with community-based organizations and partners such as the Virgin Islands Department of Health, Beautiful Dreamers Incorporated, St. Croix Women's Coalition, Virgin Islands Domestic Violence and Sexual Assault Council, Greater Changes, Island Therapy, at WestCare. Department of Health school-based implementation of the 6-week curriculum for small groups. Tier 3, these are expansive supports. School counselors facilitate family supports with the Department of Human Services to obtain social services to close gaps. School counselors effectuate appropriate referrals for consultations and clinical interventions or services to outside agencies. Again, school counselors do not provide mental health counseling. Greater Changes evaluation of students to determine the need for clinical services.
Dr. Jurgen? Morning.
Yes, proceed, Dr. Jurgen.
Dr. Jurgen, Superintendent, St. Thomas, St. John District. Mental health and wellness services in the St. Thomas, St. John District. Mental health has always been a concern in the St. Thomas, St. John District. With the support of district leaders, administrators, counselors, educators, community stakeholders, and the implementation of the district's social emotional learning unit, we have made significant strides in addressing mental health issues that confront our students. Mental health supports for students and staff. Currently, the St. Thomas St. John District has a referral system in place to support students' mental health needs. Teachers and/or staff can refer students to the guidance counselors, or students can seek out assistance directly from the counselor assigned to their specific grade level or school. School counselors assess students' needs, seek out parental support, and offer awareness of available services and resources, and/or refer students for services that are available from public or private sector providers. Similar professional services are available to the staff through the Government of the Virgin Islands Employee Assistance Program, or EAP. Supervisors can recommend that staff participate in the Employee Assistance Program if there are concerns, and/or the staff can, or on their own, access the EAP, where they can speak to a counselor, participate in the workshops offered, and/or view the EAP Wellness webcast available at cigna.com/EAP. The district continues to employ various mediums of information, including VIDE and school-based social media platforms and other electronic methods to apprise families, students, and staff of event services and resources that are available in the community. Information disseminated has also included family engagement events training opportunities, and social, emotional, and wellness opportunities. 998 Suicide and Crisis Lifeline. Efforts have been made to ensure that students and staff are aware of the Department of Health's 988 Suicide and Crisis Lifeline and how they can access its resources. Posters alerting students and staff of the 988 Suicide and Crisis Lifeline are displayed at strategic locations at each school site. The posters are available in English, Spanish, and Creole to meet the diverse home language of our students and staff. In addition, 988 cards and safety plan work assessment tools were shared with counselors, student success specialists, and the dean of students for them to distribute. Emotional crisis intervention response and response team. Both districts have an emotional crisis intervention and response team to provide students and staff with immediate support and awareness to available resources and services during tragedies and traumatic events. The team visits the respective school sites or unit to offer a forum for reflection, to meet with the students and staff collectively or individually to hear their concerns, to provide a listening ear for students and staff, to express their feelings in a non-judgmental environment, and to offer emotional support. For extreme cases, students and staff are referred to public and or private service providers for professional counseling. Mental health activities for students and staff. In the St. Thomas St. John District, students and staff were allowed to voluntarily participate in art therapy as an outlet to manage their stress levels. Art therapy was conducted at various school sites in the district, giving students in grades 1 through 12 and staff members an opportunity to enhance their physical, mental, and emotional well-being by using the creative art-making process. This activity supported self-expression, emotional exploration, stress management, and the development of self-awareness and built self-esteem. A total of 739 students and 110 staff members completed this activity. The mental health educational trainings offered to students and staff were as follows: stress management, self-care and self-advocacy, emotional intelligence, managing anger and impulsive behavior, social media literacy, bullying workshops, conflict resolution and de-escalation, disability awareness and sensitivity training, cyberbullying and associated criminal offenses, challenging behaviors, mental health talks, substance abuse prevention, getting the facts about vaping, drug prevention and healthy coping skills, managing peer pressure, and identifying, preventing, and reporting child exploitation. During these sessions, students also learned empathy as they role-played scenarios and acquired adequate skills to handle various situations effectively. Group discussions were conducted to improve their communication skills as they learned appropriate responses. In addition, they learned self-advocacy skills as they were made aware of the services, resources, and programs that are available to them. To provide the outcomes for our at-risk, to improve the outcomes for our at-risk students, additional supports were given to those attending the Edith Williams Alternative Academy. At-risk students at EWA received increased and ongoing support.
Collaboration is essential in maximizing the limited funding and human resources that plagues the department. One such example is the current work between the Department of Education and the Department of Health on a memorandum of understanding for mental health assistance to students and staff to increase student, staff, and public awareness about mental health through, but not limited to, public service announcements, guest speakers, workshops, services from behavioral health technicians, etc. Through education, the department, in conjunction with other departments, can change the face and perception of mental health, thereby reducing the stigma of mental illness. Thank you for the opportunity to testify. we stand available for questions.
Thank you, the Human Services Department. Next, we'll proceed to Lori, psychiatrist Lori McCormick, and then we'll come to my right, my left. You may proceed.
Thank you, Honorable Ray Fonseca and distinguished senators and committee members and the audience watching for having me here today. We are in full-blown crisis mode with mental health services here on the island. It is even worse than ever now. Why is it that a person like Mohammed Salem brutally stabbed and murdered his own father a few months ago, and that there are many people with schizophrenia or severe bipolar disorder hurting or killing family members or even the police? This is because there is a lack of consistent psychiatric care, and there is currently no psychiatrist at all in the Community Mental Health Center, Barbell Plaza in St. Thomas, for example, for the last 8 years to see any of our people with severe mental illness on island. I want to point out that people with severe mental illness are actually not usually violent, and they're much more likely to be the victims of crime rather than perpetrators of any crimes. But there are some people with severe mental illness who also have sociopathy, and that makes them particularly dangerous because they do tend to lack insight and have poor impulse control. There was already a lack of adequate funding for years where Dr. Lou and Spencer shared the community mental health position at Barbell Plaza. But since they retired in 2016, the Division of Mental Health has lacked funding for that position. I want to point out that the community mental health psychiatrist position really is the central cog in the wheel for all the other separate silos of mental health to work in a centralized way. So people with severe mental illness tend to be very high utilizers of hospital and medical services, and they can make their way through the ER, hospital crisis stabilization units, the BOC, where they may need stabilization and competency evaluations, and sometimes even being detained in involuntary commitments in locked facilities. So I just wanted to point out why are there so many people with severe mental illness? All across the world, roughly 3% of any population, wherever you are, has severe mental illness. And that usually includes severe schizophrenia, bipolar disorder. And so in a territory with roughly 100,000 people, that means there are 3,000 people with severe mental illness that are not getting adequate care or zero care for their psychiatric needs. I want to point out that about 3% of the population also has sociopathy, and people with that disorder don't necessarily always get in trouble. But again, when the two are combined, that can lead to a lot of problems. So if you do the math, that ends up with about 90 people with severe mental illness and sociopathy that do require quite a lot of services and require sometimes involuntary commitments into locked facilities. Wanted to point out that when I arrived 11 years ago in 2013, I worked with Dr. Rosenberg to start a Haldol decanoate clinic, which is a long-acting injectable antipsychotic for patients with schizophrenia. And this provided a much-needed service.
Can you repeat the name of that medication one more time?
Sure. It's Haldol decanoate, which is the generic name, or haloperidol. It's a very old antipsychotic medication that does help people with psychosis, particularly schizophrenia, function well. And so it was amazing to be able to see patients, that were walking on the street and homeless, and once they got their medication, they sort of wake up and say, my gosh, I don't want to be on the streets right now because this is unsafe, and they find a family member to go live with oftentimes, and then are able to access more services and get on Medicare and Medicaid and start taking care of themselves. Sometimes I give the example that a person with insulin-dependent diabetes can be quite ill if they don't have their insulin, and they can be so ill that they can even die and end up in the emergency room or the intensive care unit at the hospital. But once they have their medicine, they're functioning just like everybody else. And with mental illness, that's a similar issue, that there's a deficiency, and there's medicines that can actually correct that deficiency, and people can act as normal as you and I and live very good lives. So being able to access those medications is very, very important. I wanted to mention that when Dr. Liu and Spencer retired in 2016, I was actually asked to take over that position through the Community Mental Health Center, and that I was to give up my private practice and serve the severely mentally ill in St. Thomas and St. Croix. That budget was about $90,000, and that's about the budget of some of our nurses at the hospital. So there was no way I could do that and support my family here, so I declined to take that. Up until that time, I'd been taking Medicare and Medicaid and was also seeing patients with severe mental illness in the community. But very quickly after Dr. Liu and Spencer retired, all of the patients that needed services from them suddenly came to my clinic, and I wasn't able to. I had just gotten started maybe 3 years prior to that, and I didn't have the staff or support to see that the overwhelming amount of patients that needed my services. So I actually stopped seeing Medicare, patients with Medicare and Medicaid, and really had been trying to advocate for funding, adequate funding, for a community mental health psychiatrist at Barbell Plaza. So what I did do at that time to try and help in the meantime while we waited for more funding, I started seeing some of those patients at the East End Clinic. And then there too, things quickly got out of control, and there just wasn't enough staff, and I didn't have the time to go to the involuntary commitments to make sure that patients were to stay on their medications. Just a sidebar that patients with severe mental illness, at least 50% have very poor insight, and so they won't stay on their medications unless they're under an involuntary commitment. And I can go into the process of how a patient ends up with an involuntary commitment, but there is a process in which a psychiatrist, and it needs to be a board-certified psychiatrist and a social worker, are able to evaluate somebody that is, clearly in need of psychiatric services and is a danger to themselves and or others. And then we go in front of a judge, and then those people are given an involuntary commitment, but it's required that a psychiatrist see them on a regular basis to maintain whether that person should continue to stay on an involuntary commitment, involuntary for another 6 months, another year. If there's no psychiatrist to go to court when that involuntary commitment is up, then it will just be dropped. So there was another psychiatrist here on island, Dr. Maservi, who came a few years after I did, and he did take over seeing patients with severe mental illness at the East End Clinic. Again, there was still no funding at Barbell Plaza through the Community Mental Health Center to see any of those patients, but he quickly got overwhelmed with that too. And then in July of 2023, with the help of Dr. Rosenberg at the Roy Lesher Schneider Hospital, they developed an outpatient clinic through the hospital to care for patients with severe mental illness. That also quickly became overwhelmed, and Dr. Maservi left Island in March of this year. So that has left us in a situation where there is currently not any psychiatrist at all to see any of our people with severe mental illness. So the question then, I think, is where is all the money? Isn't there money in mental health for this? And the truth is there is roughly a $7 million a year budget for mental health. Virtually all of that money goes for paying for 44 severely mentally ill with sociopathy who are being detained in locked units stateside. There is room in Elder Shelter Brant for at least some of these 44 patients with severe mental illness. If some of the patients there were able to be seen by a community mental health psychiatrist, they could easily be brought back out into the community and cared for, and that community mental health psychiatrist would be able to hold the involuntary commitments to ensure that they stay on their medications. These days, we have even newer long-acting injectables that are even safer than the Haldol decanoate, and some of them can last up to 3 months. People with severe mental illness at Elder Shelter Brant, and when we did have Seaview Nursing Home and the adolescent unit, and at the BOC, the Bureau of Corrections, when those patients were there, there was still a lack of adequate ability to see those patients there. But one of the problems is if without a regular staff psychiatrist to be able to see patients in all of those facilities, we've lost very important federal monies from the Center for Medicare Services, which requires that patients on any antipsychotic medication be seen within 14 days of an as-needed medication within the first 6 months of being on an antipsychotic medication, and then annually. We are also losing Medicare and Medicaid dollars because there is no psychiatrist to see these patients. Whenever a psychiatrist is able to do these regular med checks, then we can bill Medicare and Medicaid to get those dollars. I think it's important to note that the Hospital Association just a few years ago allocated some money to have expert billers and coders come in so that we can now bill for those services. And that is something that could happen in all of these facilities as well. So I'd say that funding for a community mental health psychiatrist is very crucial. Ideally, there would be money for one on each island of the big islands of St. Thomas and St. Croix. The going rate would be about $250,000 annually each. And I would like to point out that I know that there's a bill, or there's some suggestion of trying to get $5 million allocated for the Charles Harwood complex in St. Croix. But I would say that throwing money right now at a brick and mortar doesn't solve the problem. First things first, a community mental health psychiatrist would not only be able to take care of the mentally ill in our community and the severely mentally ill, it could generate a lot more funding, and we can start bringing back our 7 million and our 44 Virgin Islanders back to their home. I wanted to also point out in another suggestion that has come up is that that in the Division of Mental Health that may be separated from the Department of Health to ensure that the financial budget stays the same. Currently, it can change whenever there's a new commissioner. And I did get that advice from Archie Jennings, who's a disability rights attorney, and in discussions with Honorable Senator Ray Fonseca. So I agree that also would be a good idea. Thank you.
Thank you, Dr. McCormick. We'll go with next, Miss Anya Stewart, family. You can proceed with your testimony. Yes, you may proceed, Ms. Stewart.
Pleasant good morning to all. senators of the 45th Legislature of the United States Virgin Islands, the supporting staff, fellow testifiers, the listening and viewing audiences. I am Anya Stewart, the Executive Director of Family Resource Center, a private nonprofit agency serving victims of domestic violence, sexual assault, and other violent crimes in the District of St. Thomas, St. John, and Water Island. Our agency is a 24-hour operation to include staff and trained volunteers. I thank you for giving me the opportunity to present today from the perspective of responding to the needs and hardships that victims of crime faces and the effects on the status of mental health in our communities. Victims of crimes are more prone to further and increased violent crime because of the imposed vulnerability. At Family Resource Center, for example, we know that many victims of crime experience setbacks that they have much difficulty recuperating from. Many of these lead to further victimization, the need for resources that may be limited or unavailable, compromised medical, physical, emotional, and mental health, joblessness, and homelessness. It is proven that associated illnesses such as mental health affects the quality of life in our Virgin Islands. We are a region separated geographically with limited available and affordable resources. This creates layers of hardship for many who are already economically challenged. Victims of crime may need access to medical care without the ability to pay for associated costs. Victims of crime may need medications for their resulting illnesses. Victims of crime may need counseling services, short or long term, that may not be readily available. Victims of crime may lose wages due to the inability to work as a result of damages endured from the crime. Victims of crime may use issues affecting their eligibility for programs that can offer relief. Victims of crime may feel shame or responsible for what they succumbed to. Therefore, some do not seek support or resources for relief. Victims of crime may fear retaliation and therefore retreat to avoid further victimization to them or their family members. Victims of crime may incur hardships and unkind exposure due to necessary court proceedings against the perpetrator of the crime. When a person is victimized and is unable to bear the cost of recovery, programs and funding that aim to provide support may be strained for periods of time which were not forecasted. In our territory, some agencies have been unable to continue providing services or have had to reduce staffing and programming, creating a lack in the community resources and an increase in the need of services for existing agencies. Funding shortfalls have been a common thread, resulting in these detrimental reductions. Many youths are experiencing the crime of domestic violence and/or sexual assault crisis within their homes, which is translating into behaviors of anger, rebelliousness in their homes and school at all grade levels. Young mothers and fathers show evidence that they are incapable of providing financial, emotional, or spiritual nurturing for their children and express that there is nowhere to turn. When faced with singular or combinations of these hardships, on St. Thomas and on the island of St. John, many crimes area youth go unreported and/or unpunished because of family ties. Residents also express the fear of getting involved and of reluctance in speaking to law enforcement for fear of retaliation and further victimization. Mental health in the United States Virgin Islands has been a focus of attention, especially following the significant impact of the 2017 hurricanes, Maria and Irma, and the COVID-19. The aftermath of these natural disasters and a pandemic saw a dire need for mental health due to the closure of facilities and shortage of medical professionals. although there have been efforts to improve services and support systems. Despite these efforts, challenges remain, particularly for the youth. Recent reports align with local data indicating a mental health crisis among children with high levels of anxiety and depression intensified by the COVID-19. Addressing mental health issues is a multifaceted challenge that requires a comprehensive approach. Strategies to improve mental health include maintaining a positive outlook, practicing gratitude, and taking care of one's physical health through exercise, adequate sleep, and healthy eating. It's also crucial to seek professional help when needed, engage in social activities with supportive peers, and avoid harmful self-medication practices. Mindfulness and a creative outlets can serve as therapeutic tools, and it's important to avoid negative social comparisons that can impact mental well-being. Each individual journey to better mental health is unique, and these strategies can be tailored to fit personal needs and circumstances. Implementing these practices into daily life can contribute to improved mental health and overall quality of life. Improving mental health within our community is an intricate effort that requires a collective approach. Strategies include promoting social presence and support, which can help improve feelings of isolation and loneliness, often precursors to mental health issues. Community-based interventions, such as those identified in a study mapping local policy and practice, have shown that addressing social isolation through activities and befriending services is prevalent and beneficial. Additionally, integrating mental health services with our community services can provide a more holistic approach to well-being. For instance, creating more green spaces can reduce the risk of mental health disorders and foster a sense of community. Ensuring that interventions are inclusive and address the needs of diverse groups within the community, such as older adults, minority, ethnic backgrounds, and LGBTQ individuals, is also crucial for a comprehensive mental health strategy. Moreover, consistent evaluation of these interventions is necessary to assess their effectiveness and adapt them to better serve the community's needs. By combining these efforts, communities can create a supportive environment that promotes mental health and well-being for all its members. The residents of our territory are to be commended. I know that contributing factors include programs like those at Family Resource Center, such as the Women Anger Management, Women of Worth Sessions, the Men Terminating Violence programs, the Family and Youth Crisis Intervention Program, which features parenting skill classes, adolescents programming, along with outreach events at schools, churches, community, and civic events, court advocacy, and one-on-one no-cost-to-victim counseling sessions. All of these offerings address healthy relationships at home, work, and within the community. Resources like this must continue if the safety of our residents and communities are improved. And I need to add one thing. It has been rough for Family Resource Center for the past 6 months. We have clients coming from the mainland, and they come straight to our office. The airport, whoever is at the airport would send them straight to Family Resource Center, and they come in, we do our intakes, and they come in calm and collective, and with us not knowing that they have mental health issues has become a burden on us. This young lady came in like a few months ago. She came in, we put her up in an Airbnb. We provided counseling services, resources, and whatever resources we had, we provided to this young lady. After a couple sessions, we realized that something was wrong with her. So we asked her to go to mental health to do an intake. Boy, that's when the problem started. she got angry and she said, we are the ones who need mental health. And then you know what she did when we asked her to leave? She refused. So I said, I'm going to call 911 or call the marshal, call whoever I have to call, because we had to get her out, because I had never seen this young lady look so out of it. So she agreed. When she heard that I was about to call the police, she went out. And you know what she did? She took a rock and broke our windows. Staff and clients who walk in, we are all taking a risk. And that's what we are there to do. We are there to help our community as much as we can. But we need to take further steps to better serve our community. Because these people are coming in, and they're coming in because they think they're coming to paradise. And when they come in, before you tell them, when you realize that they have an issue, it becomes a problem and they start acting up. So we really need to sit down and have multiple conversations, see how we could better help our community, because these people, they are not even from the Virgin Islands. They come from off island and they come in and they just feel that they are entitled and we have to do whatever they need. But most of the times they come with problems and issues. So let's work together as a team, and don't just sit here today and say, okay, yes, we will make it happen. We have to continue working together to make a difference.
Yes, thank you, Ms. Stewart, Family Resource Center. And yeah, that's why we're here today, to have this general discussion on mental health. Next, we'll have Ms. Tina Comisión Esquire, CEO for the Snyder Regional Medical Center. You may proceed.
Thank you. Good afternoon, Honorable Senator Ray Fonseca, Chairman of the Committee on Health, Hospitals, and Human Services, other senators present, fellow testifiers, and the listening and viewing audience. I am Attorney Tina Comisión, Chief Executive Officer of Schneider Regional Medical Center. I want to thank this committee for the opportunity to give testimony on the status of mental health and behavioral health care in the St. Thomas St. John District in the U.S. Virgin Islands. On behalf of SRMC, we thank this committee for advancing Bill number 350224, which adds a psychiatric emergency response component. The additional infrastructure is needed, and we know that mobile crisis intervention will help to better serve the public. A big, heartfelt thank you to our first responders who provide stabilization in the field and respond to 911 and 988 emergency calls. As an acute care hospital, pursuant to Title 19, Section 242A of the Virgin Islands Code, the Roy Lester Schneider Hospital on St. Thomas is required to provide emergency stabilization and inpatient care to persons requiring treatment for acute presentations of behavioral health concerns. SRMC also provides emergency stabilization and behavioral health care services at our Myra Keating Smith Community Health Center on St. John. As a public hospital and healthcare system, we are required to provide such care regardless of a person's ability to pay. Our inpatient behavioral health unit accommodates up to 8 inpatients, and we typically have a census of 6 inpatients. Patients admitted to our behavioral health unit most often have diagnoses of psychosis or manic or bipolar disorders and substance abuse problems. We also see patients with suicidal ideation secondary to depression, but those admissions are less frequent. For FY23, SRMC had 107 admissions to the behavioral health unit. And for FY24 through May 7th, 2024, we have had 83 admissions to our unit. Our behavioral health unit has an extraordinarily long average length of stay. In FY23, the average length of stay was 83 days. This is not typical or customary for an acute hospital behavioral health unit. It cost SRMC more than $1.17 million to operate the behavioral health unit in FY23. And for FY24, we have already expended more than $764,000 caring for these patients. For FY23, SRMC treated 541 patients in our emergency department for behavioral health-related concerns. SRMC has also had to bear the cost of transferring BHU patients to other facilities. Between FY23 and FY24, air transportation for these patients has cost SRMC more than $53,000. The community's behavioral health needs are significant. Individuals and families across the territory continue to be impacted by the lack of available and consistent wraparound services for the treatment of behavioral health concerns. This has led to a concerning trend of ongoing and frequent admissions to SRMC's behavioral health unit and very long lengths of stay. Without sufficient funding, accessible treatment choices, short-term housing options, and community-based support services, including case management follow-up and substance abuse rehab treatment facilities, individuals grappling with mental health challenges often find themselves in a cycle of crises, leading to recurrent hospitalizations. Our facility is currently challenged by the mandate to accept court-ordered patients from the Bureau of Corrections, Golden Grove Prison, and patients under the responsibility of the Department of Health. Many inmates with mental health issues are involuntarily committed to our behavioral health unit to await placement off-island. These patients often require additional security and monitoring. They have targeted and injured other vulnerable mental health patients on our unit, which in turn increases the expenses for our facility, as we must pay the cost of additional 24-hour security to ensure all of our patients' safety. We currently have one court-ordered patient on our BHU, and we're scheduled to get another court-ordered patient this week. The Bureau of Corrections owes Schneider Regional more than $877,000 for services rendered to their clients from 2020 to present. We need this body to provide resources to the Bureau of Corrections or directly to SRMC to resolve this arrearage. A total of $694,741 is owed to SRMC by the Department of Health for the care of their patients, of which $157,000 is for security expenses alone. Due to SRMC's small size and limited space, it is difficult for us to safely house these patients with varying levels of acuity. SRMC is also not a forensic psychiatric facility and should not be housing patients to accommodate their chronic needs. Prisons and jails on the mainland have their own psychiatric and psychological teams in place. We are concerned that SRMC's unit could be overwhelmed by the sudden influx of BOC or Golden Grove patients that should ideally be managed in a psychiatric service within the BOC or Golden Grove system. In the short term, we are advocating for collaboration with the BOC and with the legal system to provide the resources to improve the security measures. When patients are court-ordered to SRMC, they must be provided appropriate security and monitoring for these patients to ensure the security of all of the patients on our behavioral health unit. In the long term, our community would immensely benefit from establishing services within the correctional system, as providing this specialized care not only reduces the burden on SRMC's BHU, but also improves outcomes for those individuals. Discharge planning is a major concern for SRMC's behavioral health unit, as the lack of available housing in the St. Thomas St. John district makes it difficult to ensure continuity of care. Due to the lack of availability of short-term housing and the lack of outpatient community treatment options, patients frequently do not follow up with their outpatient psychiatrist or therapy team, which leads to medication noncompliance, subsequent decompensation, and then readmission to SRMC's emergency department and behavioral health unit. Most of the newer, long-acting antipsychotic, once-a-month injectable medications, such as Invega, that are easily accessible and affordable in the States are not covered by our Medicaid program here in the territory. These second-generation antipsychotics are currently the standard first-line treatment for psychosis, with the most benign side effects profile available. Because these second-generation injectables are not covered by the local insurance companies here in the VI, we are left with limited medication options for the outpatient treatment of the chronically mentally ill. If our Medicaid program were to expand coverage for essential medications, we would have a better chance at reinforcing medication compliance, as the financial barriers that presently exist would be reduced. This, in turn, will lead to better outcomes for our patients with chronic mental health issues. It is also difficult to find consistent treatment options for patients with substance abuse difficulties. We have placed multiple patients at the Village in St. Croix in the past years, but at times they have a waiting list. Investing in expanding and diversifying substance abuse treatment options through partnerships with community organizations and private providers would be one way to increase access to comprehensive substance abuse treatment programs. We welcome the opportunity to collaborate with our policymakers to prioritize funding for short and long-term housing alternatives, outpatient resources, insurance reimbursement, and we are committed to continuing working with the BOC, the Department of Health, and the courts on warm handoffs and transitions for our patients to improve mental health care in the territory. We need to work together to ensure that the mentally ill in our community receive the necessary support to be successful. We support the expansion of behavioral health treatment options in the territory. As the community's hospital, we will continue to play an active role in the provision of behavioral health services to the community by providing emergency stabilization and inpatient hospitalization for patients with acute behavioral needs. We want to say thank you to all of our partners in government and in the community organizations who are serving people who suffer with behavioral health issues. And before I close, I want to thank all of the dedicated, hardworking employees of SRMC who are taking good care of our community. I want to especially thank our compassionate, skilled behavioral health team who are serving our inpatients, our emergency room patients, and the outpatients that we now serve in our newly opened wellness clinic. We offer robust services in our new SRMC Wellness Clinic, which opened about a year ago. And if you need services, we encourage you to call us at SRMC for an appointment. We have added 2 psychiatrists recently to our SRMC team, one of which will begin very soon, and one of which who will provide services in the outpatient wellness clinic that we have opened. We also have licensed clinical social workers on our team, nurses who can administer injectables, a nurse practitioner, and therapists who provide specialty care. There is a need for more providers and more psychiatrists at the Department of Health Mental Health Clinic and at the East End Clinic and throughout the community, and we support all efforts to introduce those providers. We want to encourage the public to trust Schneider Regional with your care, your health care, and your wellness care. You can get good care right here at home. Your confidentiality is assured, and you can get better and loving quality care with kindness than you can get anywhere. SRMC remains an advocate for the expansion of all healthcare services in the Virgin Islands, and we will continue to partner with all stakeholders to ensure that quality care is provided to this community. This concludes my testimony, and I welcome your questions.
Thank you, Tina Commission from Roy Lester Snyder Hospital. Ms. Commissioner Sims and Rhiannon Steele, we got that testimony. It was one unified testimony. And so I think we'll go to Mrs. Potter from East End. Mrs. Potter, you may proceed.
Good day, Mr. Chairman, the Honorable Senator Ray Fonseca, members of the Committee on Health, Hospitals, and Human Services, and the listening audience. I am Paulette Venzen Potter, the Operations Manager and Clinical Social Worker for the Behavioral Health Program at St. Thomas East End Medical Center, STEAM CC. I begin my testimony today by expressing my sincere gratitude for this opportunity to appear before this auspicious body to discuss the behavioral health program at STEAM-CC and to highlight the need for greater emphasis on mental health and mental wellness. I have worked at St. Thomas Eastern Medical Center for approximately 6 years, first as a case manager and now as a clinical social worker and operations manager. It is not unusual in today's world to turn on the TV or radio and hear people discussing the topic of mental health and its impact on the lives of individuals and communities. While the stigma remains, our awareness is shifting, and mental health is coming out of the shadows. However, there are still too many of us who view mental health the same way our parents did, as something to be ashamed of or ignored. Today, nearly 1 billion people live with a mental health disorder. Every year, close to 3 million people, about the population of Arkansas, die due to substance abuse. And every 40 seconds, a person dies by suicide. About 50% of mental health disorders start by the age of 14. The STEAM-CC Behavioral Health Team is mindful of the needs of our community and the necessity to improve access to behavioral health care and wellness throughout the territory. Our team is anchored in recovery and resiliency. At STEAM-CC, we address mental health from a holistic approach, focused on prevention, policy changes, health and healing, wellness, and well-being. The status of our behavioral health program, types of services. Currently, the behavioral health team consists of 2 licensed clinical social workers. We offer a multicultural, trauma-focused approach to therapy that prioritizes understanding and respecting everyone's unique cultural background. Our specialized team is trained to address trauma effectively, providing compassionate care and tailored support to help people heal and thrive. Our services include individual therapy, group therapy, family therapy, couples therapy, support groups, psychoeducation, presentations, and case management referrals. We treat various diagnoses, including depression, anxiety, bipolar, schizophrenia, and PTSD. Currently, we are running a weekly women's support group at the center and a skill-building group with the residents at Yellow Cedar Residential Facility. Both groups are open-ended, and members may join at any time. For the 2023 calendar year, behavioral health providers saw 2,306 patients. However, psychiatric services were discontinued after the first 3 months due to the departure of our psychiatrists. For the first 4 months of the 2024 calendar year, behavioral health providers, specifically 2 licensed clinical social workers, saw 162 patients, resulting in 737 visits. Our group sessions began in January of 2024 and is scheduled to meet weekly. Our women's group include a total of 15 women, and our skill building group a total of 12. Most of our patients, not including groups, are seen bi-monthly. However, many of our patients receive weekly support because of their mental health challenges. The current needs of the behavioral health program. Let me preface this part of my presentation by saying that more funding is necessary for the behavioral health program to meet the needs of those we serve. Staffing, executive and executive assistant. This individual will assist with running the day-to-day operations and executive duties. Currently, with only 2 therapists, most of my time is spent seeing patients. A psych nurse practitioner. This individual will provide medication and counseling therapy. The psych nurse practitioner collaborates with the psychiatrist, and the psychiatrist serves as a consultant. This approach saves money, but still provides optimum patient care. A psychologist. This individual will be able to provide various assessments and psychological testing, which can assist the Department of Education with their needs for more psychological services. behavioral health therapist. This individual will provide more counseling services. Space. As we build out the behavioral health program, more space will be needed to accommodate new hires, student interns, play therapy room, a group therapy room. The space that we currently use for groups has been donated to us by the owner of Tutu Park Mall, but at any time, that space may be rented. I would like to publicly thank Ms. Lilibet Foster for her generosity in allowing us to use that space. Telehealth video capability. Currently, our telehealth services are provided over the phone. Video capability will help the therapeutic relationship, give patients options, and decrease no-shows. Training. Funds for training. Mental health is a dynamic field, meaning best practices change over time. This is why most mental health professionals are required to regularly earn continuing education credits. Our clients deserve clinicians updated on new developments to ensure the best care possible. A grant writer and a grant manager. This individual will be responsible for writing and managing grants to help increase our funding sources. I think it is worth repeating that more funding is the only way that we can build our behavioral health program and help our patients. Our future goals. Expand outreach efforts. The present goal is to provide group therapy to schools in the St. Thomas St. John district at the school sites. Students who may need individual therapy are currently expected to come to the center to receive this service. In the future, we would like to provide both individual and group therapy at the school during the school day. This will help to eliminate the barrier to care. This can only be possible with more staff, which requires more funding. We have started collaborating with other residential facilities to provide behavioral health services on site. Increased student supervision. STEAM CC is committed to supporting individuals in the behavioral health field to help ensure the availability of qualified providers. One of our goals is to collaborate with the Department of Education and the University of the Virgin Islands to promote professional career options in the behavioral health field. Currently, our achievements in this area have been hampered by the limited number of staff. My final thoughts. I think we can all agree that mental health is a serious concern. We all have stories that we can share about how an unaddressed mental health condition led to devastating results. So the question is not, do we have a problem? But rather, what are we doing individually and collectively to improve our mental health crisis? Most of the patients we see at STEAM CC have Medicare or use Medicare, Medicaid, or are uninsured self-pay. STEAM CC utilizes a sliding fee scale for payment. However, many patients, including students, have been denied care due to their inability to take advantage of our sliding scale. Mental health is like no other disease because of the shame it bears. Parker S. Huntington wrote, and I quote, "I wish I had cancer or some other grand battle, dementia, stroke, organ failure. If I lose those fights, I'm brave. But the thing I'm battling with is my mind. And if I lose, they'll just call me weak." End of quote. So I implore the honorable members of this esteemed branch of government, businesses in the community, and all citizens in general to remember that mental health wellness is worth the investment. I'd like to say that again. Mental health wellness is worth the investment. We must educate ourselves, allocate financial resources, and invest the time to ensure that collectively we are doing our best to preserve mental health wellness in our community. Thank you so very much for lending me your ears. I am available to respond to questions regarding my testimony. Thank you.
Thank you so kindly, Ms. Paulette Vincent Potter of STEM CC. I now know where our honorable senator gets those well-written statements from. Thank you. We'll go now to Ms. Doreen Hairston from Nana Children's Care.
Testing.
You may proceed.
Thank you. Good afternoon, Honorable Senator Fonseca, esteemed members of the Committee on Health, Hospitals, Human Services, and all the sitting audience. My name is Darian Therese Hairston, and I'm appearing before this court today to discuss my experiences with the pressing issue of the mental health crisis in the Virgin Islands. I'm a clinical social worker and the director of Nana Baby Children's Home, so I've witnessed firsthand the effects of some of our inadequacies in our mental health care provision, more so as it relates to some of the financial inadequacies, lack of placement and care options, supports for youth drug and alcohol abuse, and early intervention. The U.S. Virgin Islands, like many other regions, faces a significant mental health crisis that has been exacerbated by a multitude of factors such as geographical remoteness, limited resources, high levels of poverty, unemployment, and housing insecurity, and impacts of natural disasters. Furthermore, there is a stigma that surrounds mental illness, and it remains a significant barrier to seeking help in the U.S. Virgin Islands. Deep-rooted beliefs and attitudes towards mental health often prevent individuals from acknowledging their struggles or for reaching out for assistance, especially as it pertains to the early intervention of children. Many of the children who have been placed at Nana Baby Home have experienced challenges with mental health. Because all of our children receive Medicaid or MAP, we've been able to ensure they receive therapy and access to some services. However, in many of the cases, no treatment was being provided to the children before entering care. This is encompassing more than just therapy. This is children who need speech therapy, occupational therapy, psychiatric care, drug and alcohol support. It's clear that early intervention is missing if children are not receiving care for their mental health until they enter the social services branch. Furthermore, Nana Baby Home provides care for children who are age 0 to 12 years old. However, since the recent closing of Seaview, a residential facility, there are limited to no homes for children ages 13 to 18 years old. Nana Baby Home has provided emergency care for 6 teenagers in the past 3 months, all of who are struggling or dealing with significant behavioral challenges, mental health conditions, or drug addictions. In one recent example, one of our residents began having serious life-threatening symptoms due to an emergent psychiatric disorder with a neurological component. They were admitted to the hospital where they stayed for a week. It was recommended that due to the unique nature of their diagnosis, they be transferred off-island for enhanced diagnostic measures and immediate treatment. We do not have the capacity to properly diagnose or treat them on St. Thomas because the diagnosis is such a subspecialty. However, the hospital was informed that our medical assistance program would not pay for the transfer because it was too expensive. The adolescent was then discharged back to Nana Baby with only a referral for a consultation with a neurologist. Before we could even make it to that appointment, the symptoms reemerged and they were back in the hospital. A day later, they were hospitalized again. Their symptoms prevented them from going to school, going after school programs, and finally even residing at the home because we could not provide adequate care. However, the MAP program still would not cover the cost to move the child off island. No one can predict the future, but it was the recommendation of multiple physicians and psychiatrists at the hospital that the adolescent be transferred during the first few days of hospitalization. They would have received appropriate care immediately and been spared several traumatic situations that followed. I'll also briefly mention a current situation involving another teenager who's battling significant issues with marijuana. They're using it to cope with racing thoughts and depression, and they seem unable to quit, despite several natural consequences that they're facing. We've not been able to locate drug and alcohol courses for them, and though they're receiving therapy, psychiatric support, and medication support, they're not able to make the necessary changes. The teen feels their behaviors are normal for living here in the Virgin Islands and see marijuana as the only way to cope. In light of some of these challenges, it's evident that action is required to address some of the mental health crises and issues in the Virgin Islands. This includes increasing funding for mental health services, expanding the workforce of the mental health professionals, and implementing more community-based interventions to reduce stigma and promote early intervention for our children. I urge this court to recognize the severity of the mental health crisis and take decisive measures to address it. The well-being of our community depends on our ability to provide adequate care. Thank you for your time.
Thank you, Ms. Dorian Hairston, for that testimony. What we'll do now is we'll go to the testimony online. Do we have any testimony online? I know we have a few present online. We may proceed online. I know there was no testimony from Nurse Davis, but any online testimony, you may proceed. Teams.
Good day, Honorable Senator Fonseca, Chairman of the Committee on Health, Hospitals, and Human Services, and members of the 35th Legislature of the U.S. Virgin Islands Committee on Health, Hospitals, and Human Services, as well as all community organizations here today. My name is Lily Cox, Director of Communications and Community Investments at St. Croix Foundation for Community Development. And on behalf of the Foundation and our Kids Count USA team, I submit this testimony in support of the well-being of the children of the U.S. Virgin Islands. Our testimony today centers around the experience of children, older youth, and their families with a particular emphasis on mental health, the necessity of current data. A systems thinking approach can yield a more comprehensive and cohesive network of supports for our children, including sound policy. For over 30 years, St. Croix Foundation has served the U.S. Virgin Islands as a place-based foundation, serving as a grant maker, web service provider, a community development civic leader, and a fiscal sponsor for over 250 grassroots nonprofits. In total, SCF has been a conduit of over $44 million in investments into the U.S. Virgin Islands. Our initiatives spanning economic development, community revitalization, and youth and educational programming have earned SCF national and international recognition in almost every priority area. And because our work to nurture a robust civic nonprofit sector expands far traditional grant making, our collaborative and rooted approach to community development, data collection, policy advocacy, and direct services has afforded SCF a deeply holistic systems perspective and a wealth of qualitative and quantitative data. As the territory's Kids Count steward since 2020, St. Croix Foundation is uniquely positioned to utilize current and historical data to paint a picture of the various ways in which our young people and families are faring, particularly in the wake of 2 Category 5 hurricanes and then a years-long global pandemic. The data is officially in. As reported in SCF's 3 Kids Count USVI data books from 2021 through 2023, there are so many crisis points surrounding our children that it is difficult to measure the cumulative impact on their mental well-being. For contextual framing, here are some data points that paint a broad picture of the state of our children in the USVI. The territory's child population has halved, 34,289 to 17,086 in just 20 years. Only 4.2% of public high school 11th graders were proficient in math in the 2021-2022 school year. And we have witnessed a rise in the number of suicides among our young people in the past year that gives heavy weight to post-hurricane data on mental health among our children. These data indicators and more compelled SCF's Kids Count team to issue a call to action in our most recent Kids Count USVI data book published in December 2023. In a 2020 New York Times article, It's Life or Death, the Mental Health Crisis Among U.S. Teens, one psychologist who was quoted offered a stark warning: it's life or death for these kids. We in the territory should be taking heed. While local data on mental health is extremely limited, Data collected in 2018 through the Youth Risk Behavior Survey, or YRBS, provides some alarming insight regarding the health and well-being of USVI youth. Reported in the St. Croix Foundation's 2021 Kids Count USVI data book on page 38, the most recent USVI YRB survey collected data almost 1 year following Hurricanes Maria, but 2 years before the onset of COVID-19 on mental health and substance use among school-aged children in the USVI. Conducted by the Caribbean Exploratory Research Center at the University of the Virgin Islands, contracted by the VI Department of Health, the YRBS sample consisted of all students in all public schools enrolled in grades 7 through 12 in the 2 school districts of St. Thomas, St. John, and St. Croix during the 2017-2018 school year, making these young survey respondents approximately 5 years older today than when they were initially surveyed. The sample included students enrolled in 4 junior high schools, 1 middle school, 1 K through 8 school, 4 senior high schools, 1 alternative education academy, and 1 technical education center. Over 100 sampled public middle school students reported that they have attempted suicide. Across the 1,280 middle school students who completed the survey, 32.5% felt so sad or hopeless almost every day for 2 weeks or more in a row that they stopped doing some usual activities, a symptom of clinical depression. 22.5% seriously thought about killing themselves. 15.3% reported they made a plan, and 8.5% actually tried to kill themselves. Nearly 200 of sampled public high school students reported that they have attempted suicide. Across the 1,782 high school students who completed the survey, 35.5% felt so sad or hopeless almost every day for 2 weeks or more in a row that they stopped doing some usual activities. Even more alarming, 17% had seriously considered attempting suicide, 13.6% had made a plan, and 10.3% had actually attempted suicide. So when we say it's life or death for our youth, we mean it, literally. Nationally, suicide by Black adolescents, particularly Black girls, rose 73% from 1991 to 2017, compared to an 18% rise among white adolescents. The VI's local YRBS corroborates the gender differences in mental health experiences, finding that female students were almost twice as likely as male students to report feeling sad or hopeless almost every day for 2 weeks or more in a row that they stopped doing usual activities. 26% of female identifying students versus 23.6% of male identifying students. Over 800 female public high school students, nearly half of the sample, are reporting a primary symptom of depression. Decades of psychological research show that the rates of internalizing problems, such as depression, anxiety, withdrawal, and eating disorders among adolescent girls are higher than the rates for boys, while the rates of externalizing problems, aggression, oppositional disorders, delinquency, and school problems among adolescent boys exceed rates for girls. Factors related to the rise in mental health issues noted in the 2022 New York Times article include the rise of social media, the decreasing average age of the onset of puberty, and trends indicating that teens these days are getting less sleep and exercise and spending less time in person with friends. Not mentioned in the article were the effects of trauma and adverse childhood experiences, referred to as ACEs, of which our youth have experienced many, from the 2017 hurricanes to the COVID-19 pandemic, not to mention less cited experiences of bullying, witnessing crimes, maltreatment, and other adverse events. Notably, increased depression among adolescents living in poverty was also not mentioned. As reported in the 2023 Kids Count USVI data book, the territory's child poverty rate has from 29.6% in 2015 to 33% in 2020. And rates for children under age of 5 are even more startling at 37% territory-wide and 42% on the island of Croix. Moreover, in a recently released New York Times bestseller entitled The Anxious Generation, social psychologist Jonathan Haidt addresses the epidemic of teen mental illness in children worldwide, particularly in developed nations. Deemed one of the most important books of our time on this topic of youth mental health, Haidt shines a spotlight on Generation Z, those born between the mid to late 1990s and the early 2010s. According to Haidt, 3 major shifts impacted youth this generation unlike any other. 1, the rise of social media. 2, overprotective parenting. And 3, a decline in play-based childhood. Haidt offers some targeted yet radical systems-level recommendations for addressing youth mental health, including reprioritizing playtime, identifying more ways to embed children in safe, stable, real-world communities beyond online
Hello,
networks.
Ms. Cox, excuse me 1 minute. We're having difficulty locating your testimony. Can you make sure that we get a copy of your testimony? We're having difficulty locating your testimony.
Yes, that was sent early this morning again, but I will make sure it's resent.
Okay, thank you. You may proceed. You may proceed.
And third, delaying the introduction of smartphones and access to social media platforms, instead reintroducing basic flip phone as first phones. Our children's story, our collective story. Undoubtedly, of all the data we have the privilege of sharing, YRBS data is particularly special, crucial, in fact, because it comes from our children. Like a blaring SOS or an outstretched hand in a turbulent sea, through this data, it feels like our children were, and perhaps still are, begging us to toss them a life raft. Of course, while it's no consolation, we remind our community that national trends suggest that we are not alone. Children across the nation are facing a collective and unprecedented mental health crisis. Suicide rates among youth ages 10 to 24 in the U.S. increased by 57% between 2007 and 2018, according to a 2020 National Vital Statistics report. Beyond the individual experiences of difficult circumstances, it would behoove us to be mindful of the impact of stressors on a community level. The American Psychological Association, APA, recently released a report titled Stress in America 2023, A Nation Recovering from Collective Trauma. This report examines the lasting psychological impacts of the combination of era-defining crises, including the pandemic, global conflict, racism and racial injustice, inflation, and climate-related disasters. On St. Croix, recent focus groups hosted by St. Croix Foundation with partner Mercy Corps, Inc., brought together rank-and-file parents, business people, and clergy to discuss what the wider community, all adults, were experiencing. Subject to the same onslaught of trauma as our children, who also participated in a focus group, these adults expressed the lasting effects of multiple stories, including the high cost of living in the USVI and the destruction of major infrastructure, such as roads, schools, the hospital, and then COVID-19. The data points to the significant impact of collective trauma being evidenced by an increase in chronic illnesses and mental health challenges. According to the APA, psychological science has revealed that long-term stress creates risk for a variety of mental health challenges, may make more sensitive even to daily hassles, can have broader impacts on our general life outlook and goals, and affects the body's physiological response to stressors in ways that have notable implications for our physical health. Stress puts the body alert, and ongoing stress can accumulate, causing inflammation, wearing on the immune system, and increasing the risk of a host of ailments, including digestive issues, heart disease, weight gain, and stroke. Like all other challenges before us, the well-being of our children's mental health will take more than just one program, one policy, or one nonprofit or public agency. It will require a systems approach in which all members of our community across the public, private, and civic sectors collectively elect to do differently. More than the challenges, we at SCF and the Kids Count team often reflect on the tremendous opportunities presented to us given our small geographic areas and population size. We believe that with courage, ingenuity, and collaboration, it is possible to make significant progress. To do so, we suggest taking a data-informed approach centered around results-based accountability. Our recently hosted Kids Count USVI Summit represents St. Croix Foundation's strategic agenda around systems building as we seek to elevate and lead a collaborative process of co-creating new, cohesive systems of support for our territory's children. This strategy will demand our collective acknowledgement that the current systems are simply not working, and a willingness to build competency around new ways of doing and being, which will lead to radical systems change. Additionally, it is essential that we commit to regularly collecting, disseminating, and utilizing current data in order to understand the true state of our children and families in real time. From there, we can establish coherent programmatic and policy agendas while strategizing around systems change levers that will ultimately create a new ecosystem for our children. And that concludes my testimony. If you have any questions, please let us know. We are available.
Yes, thank you so kindly for the testimony. And you said that the testimony was sent early this morning, right?
It was, but I'm now that it is being resent as we speak.
Okay, thank you very much. So next we're gonna, is there any other additional online Teams or Zoom testimony? If not, then we'll proceed to the Women's Coalition of St. Croix, Dr. Clement Lewis. If there's no other online. Okay, we'll proceed to St. Croix, the Women's Coalition. You may proceed.
Good afternoon. Good afternoon, Honorable Senator Ray Fonseca, Chairman of the Committee on Health, Hospital, and Human Services, and the other honorable senators that's on the committee and are present today in the chambers, as well as other testifiers and people who are viewing and listening to this testimony. I am Dr. Clement Lewis, Executive Director of the Women's Coalition of St. Croix. I have brought with me Ms. Shalene Gums, our Director of Crisis Intervention Services, in case you have additional questions to ask us. Thank you for inviting us to attend this hearing. We were a little surprised, but we are here and ready to offer our suggestions. The state of mental health or behavioral health in the territory for us is devastating, and it continues to decline. There's a stigma involved with reaching out for help for behavioral health services. No one wants to be labeled as mentally ill or crazy, so they do not seek services, and they really need the services. There's also an issue with families as well because of the shame and embarrassment of seeking services for their loved one. People with mental disabilities have been raped, abused, and even died on the streets of St. Croix. They are taken advantage of. They are our vulnerable population. If we don't do something soon about the state of mental health, behavioral health in our territory, the overall state in the territory, it will continue to deteriorate and decline, and the quality of life for our people will continue to fail. We have also seen a rise in people with disabilities flying in like Anya Stewart mentioned from St. Croix, is getting unbearable almost on a weekly basis or more. We have people flying in the territory from the mainland with absolutely no resources. Most of them have mental illness issues, and they're mostly sent to the Women's Coalition because the majority of them are female. And we have no resources to provide for this new population on St. Croix. The Women's Coalition is a 501c tax-exempt organization. We was founded in 1981. We operate 24/7, 365 days out of the year. We provide crisis intervention, counseling, advocacy, food, clothing, and shelter to all crime victims. We do not provide shelter for people with mental disabilities because we don't have those services available, and that is not our area of expertise. All our services are provided free of charge, and we are not a behavioral health facility. And I have to keep saying that because the police, all the government agencies continue to refer people to us for shelter. And I would like to put that on the record. We're not that place. Okay? During 2023, we served 1,445 victims of crime. Out of that number, 25% of our population suffered from some form of mental health disability. We provide them with following services: food, clothing, advocacy, counseling, family support, toiletries, and referral to other agencies. Most of the people who seek services are victims and survivors of domestic violence, sexual assault, child abuse, and survivors of homicide. That's our expertise area. Our agency is not staffed with a psychiatrist or psychologist because we cannot afford this expense. We are a nonprofit. We do make referrals to agencies that provide behavior services, as well as the Department of Health, Division of Behavior Health. We also pay for those services when we make the referrals to private entities. The Women's Coalition is staffed with, we are a crisis center agency. Our staff is qualified. Well, let me say this over, sorry. Our staff are trained in crisis intervention counseling. We have psychology, criminal justice majors. We have bachelor's, master's, special degrees, and recently our director became an honorary doctor. We are not mental health, behavior health specialists. I want to make that clear for the record. We work in behavioral health, but that's not our expertise. Our agency services, our staff spans from 5 years to 41 years working in the field of crisis intervention. Please note, some of the people that do come to us for mental health disabilities also experiencing substance abuse, so they have co-occurring diseases as well. We have called Virgin Islands Police Department on numerous occasions for people with mental illness that come to our facility. Our complaints on my agency range from destruction of property, graffiti, defacing our buildings, urinating, defecating around our buildings, sleeping in our stairways, leaving trash, and threatening our staff. We've even recently had a person with a mental disability try to set one of our buildings on fire, someone that we had provided services to. When we do call the police, we have been informed over and over, because we have filed numerous reports, is that we need to contact our senators so that they can correct the laws, because they can't do anything. Below, I would like to give you some examples, because the Senator Fonseca did ask for population, and he asked for stats. We gave those, but he wanted an example of the type of people that we see in our agency. So I have some examples. A middle-aged woman comes into our office. She suffers from multiple personality disorder. The Women's Coalition has become a facility and a safe place for many people who have mental disabilities, because you can just walk in our office and we always have crisis intervention service. Not to mention, we're 24 hours and they take advantage of our hotline. So 2, 3, and 4 a.m. in the morning, we getting calls from people with mental disabilities. Just because they want to talk, they might need their medication or some other services because there's no one else taking those calls. A young man comes into our office who suffers from schizophrenia. He has anger issues. He comes to our office trying to get assistance for applying for a job, making connections just to talk to his family. There's another young man who came in our office the other day just to speak to someone. Remember, we have a lot of people on our streets with mental illness with nowhere to go, and they look at a lot of the health facilities as they don't want to be labeled as being ill, so they rather come into an agency that they feel don't have that stigma. And so a lot of times we kind of get stuck with trying to find resources. There's a young woman who suffers from bipolar disorder, and when she's manic, she comes to the office and she is all over the place for the entire staff. We have another young woman who's schizophrenic. These are the people that come to our office on a regular basis, and we come through our office. A mother who was sexually assaulted by her mentally ill son is one that comes close to my heart. He was arrested, and then he was released. He went back home and continued the sexual assault. So we also have the family that don't want their child arrested. They don't want them in jail, but they're not getting any kind of services, so they reoffend the family, whether it's domestic violence or sexual assault, set the house on fire. It's really a sad situation in our community. We have a mother who has a son that's mentally ill. He burnt her house down. She can't be compensated for it because he lived in the house. No charges was filed. He's back out on the street. Every time we try to assist them, we try to take them to the hospital or somewhere to receive services, within 24 hours, they right back at the house or right back on the street. We have a mother that's trying to get services for her daughter that she's been taken around. This is a sad situation. She's been to me 3 times. Her daughter has mental disabilities. She's taken her around to every agency because she has nowhere to place her, and she wants us all to continue to house her in hotels because there's nowhere for this young woman to go. There's a lack of services that we all know in our community. We just want to stress them because we feel them every day, because we get called every day by either government agencies or the police or just people in the community. If there's a homeless woman on the street, if she's homeless, if she comes in the airport, I believe Port Authority, the taxi drivers, everybody feels like that's the Women's Coalition responsibility because she is female. That's the bottom line. We know that's because she's female. There should be continued outreach through behavior health after 5. Also at 5 o'clock when the Division of Mental Health closed and all the government offices closed, where do you think they're going? They're going to go to agencies that's still open, and we happen to be one of those that's open all the time, so why wouldn't they reach out for services? Their lack of housing, trying to find housing for them is another issue in the community because of their depressive and manic behavior, trying to get them to maintain the housing. The waiting list for housing, just like for people that don't, is 1 to 5 years. Limited services, there's nowhere for people to go. We try to get, we get things like, can you help us get medication? Because I don't know if you're aware, but MAP don't pay for certain medication for people with mental illness. So they come to us to pay for the medication, and we don't have money for that. So we try to work out the formulary grant with MAP, which is another story, trying to get the stigma. Let's not mention the stigma. Let's not mention when we try to call families and other people in the community to come to our agency and support us to work with it. Nobody wants to deal with it. Everybody wants to bury their hands in the sand. And the truth is, what do? Your loved one is on the street. We've had 2 of our clients' sons that have been killed at night because they walk in the street, they have mental illness and substance abuse, and 2 people have ran them down and killed them. So what happens? We provide homicide services for that family. Nobody else is going to do that. That's what our community look like. We don't have a psychiatric ward that we know of. There might be a holding place. When we take people to the hospital and try to get them admitted because we can't do anything with them, I have to be honest, within 24 hours they are released, they back on the street, and then we're trying to figure out what to do after 24 hours. And we can't handle it anymore. So we need services, round-the-care services for people with disabilities. We need services for the family. And as was stated earlier about most of all the testimonies, we have to do this as a community, not one entity, not one agency, whether government or private can do this alone. We have to find a way to work as a team and somehow share in the load of trying to help people with disabilities. And we all for supporting that. The National Institute of Health reported that 57.8 million adults have suffered from some form of mental illness, and it's just our luck they're now getting on the planes coming to St. Croix. I want to employ this committee and the other testifiers and people that's listening. Instead of us just talking about it, we got to find a way to come together and make a difference in the community. Thank you.
Thank you, Dr. Clemma Lewis. I'd like to acknowledge the presence of Committee Vice Chair, our Honorable Senator Kenneth Gittins, Majority Leader of the 35th Legislature. The Committee on Health, Hospitals, and Human Services will stand in recess for 30 minutes.
nature of man. It's the earth man. Rasta man. I listen to the first.
What is a Rasta man? The man we set the plan. The man we touch the street. Love and bless up everyone. The Rasta man no skip a beat. The Rasta man unique. We not go take defeat. The mission not be complete. And through the humble and the meek. My lyrics is my gun. No boy can't tell me no. What is the empress? She rise above the rest. Empress no beg no friend. Real empress no bend.
The Committee on Health, Hospitals, and Human Services is back on the record. We've been having a discussion so far on the status of behavioral health in the Virgin Islands, and so far what we're seeing is that addressing the behavioral health issues must involve all of the community. It's not just the government, it also includes the private sector, the nonprofits, all the different organizations. And we must also accept that mental health and behavioral health it's a serious issue. Behavioral health involves depression, uncontrollable temper tantrums, impaired learning, post-traumatic stress disorder, etc. And it must be treated with priority as all other illnesses. Mental health must be treated on priority like if you have cancer or diabetes. We can no longer wait for mental health treatment. It hurts. Mental health illness hurts right now, and it has to be treated right now. Because, if your child has a broken bone or the flu, you can go to the hospital and get treated immediately. Mental illness must be treated the same. Mental illness is also about ending the stigma, the discrimination that the mentally ill persons face in the community. So we must treat behavioral health illness like all other disease, kidney, heart, stroke. And remember, there's a hotline, there's a 988 hotline that you can call. So we're going to go testimony, we're going to go to Doug Cook, and then we're going to go Doug Cook of Wang Louis, and then we're going to go to Miss Webster from Frederick Stead Health Center. So Doug Cook, you may proceed with your testimony.
Good afternoon, Honorable Senator Ray Fonseca, Chairperson of the Committee of Health, Hospitals, and Human Services, Senators of the 35th Legislature of the U.S. Virgin Islands present, and the listening and viewing audience. I am Douglas Cook, Chief Executive Officer of Governor Juan F. Louis Hospital and Medical Center. To assist me with this presentation today is Chief...
Doug, just 1 minute. The Committee on Health, Hospitals, Human Resources in recess for Human Services in recess for 1 minute. We need to get the stenographer organized. The Committee on Health, Hospital, and Human Services is back on the record. We are going to proceed with Mr. Doug, CEO Doug Cook, and then we're going to go to Ms. Webster, Frederiksted Health Center, and then we're going to have the testimony from the Bureau of Corrections. So, CEO Cook, you may proceed with your testimony.
Good afternoon, Honorable Senator Ray Fonseca, Chairperson of the Committee of Health, Hospitals, and Human Services, Senators of the 35th Legislature of the U.S. Virgin Islands present, and the listening and viewing audience. I am Douglas Cook, Chief Executive Officer of Governor Juan F. Louis Hospital and Medical Center. To assist with this presentation today is Chief Nursing Officer Doris Plaskett. Before we delve into the focus of this testimony, I would like to take the moment to express my heartfelt appreciation towards the incredible staff of JFL, the Territorial Hospital Redevelopment Team, and the Territorial Board for our successful move to from JFL Main to JFL North. We are proud that we have been providing patient care services for the past 13 months in the new location since we moved April 22nd of 2023. We have a critical issue of mental health in the U.S. Virgin Islands and an urgent need for a collaborative approach to addressing this pressing concern. Mental health is a vital component of the person's overall well-being, yet individuals in our community continue to face barriers to accessing the care and the support they need. As a community, we must come together to prioritize mental health services and support systems that are accessible, affordable, and culturally sensitive. By working collaboratively with government agencies, healthcare providers, community organizations, and individuals with real-life experience, we can develop comprehensive solutions that address the root causes of mental health challenges and promote healing and resilience. It is essential that we invest in mental health resources, expand access to care, and destigmatize those seeking mental health services. Together, we can create a more supportive and inclusive environment with all individuals can thrive and receive the care they deserve. I would now like to turn the testimony over to Doris Plaskett, who will briefly outline the current and future services of JFL. Thank you.
Good afternoon, Senators and the listening and viewing audience. I am Doris Plaskett, Chief Nursing Officer of the Governor Juan F. Louis Hospital and Medical Center. As you know, JFL North represents a temporary hardened structured hospital with 52 inpatient beds. This is broken down into 23 med-surgical beds, 12 critical care beds, 10 labor and delivery beds, 4 neonatal intensive care, and 4 pediatric beds. This is relatively the same number of operational inpatient beds we had available in JFL Main before the move. JFL North also has several innovative technologies, such as 4 surgical suites built to the latest standards with much larger square footage. The 26-bed emergency department has 13 general observation treatment bays, 3 isolation rooms, 2 trauma bays, 4 fast-track bays, and a separate 4-bed critical stabilization area for behavioral health. The behavioral health area is located in the heart of the emergency department. It has 4 padded patient rooms, 1 bathroom, and a nurse's station. This area is basically designed for behavioral health crisis evaluation and short-term patient stabilization. JFL's medical practitioners, psychiatrists, and staff work collaboratively with other agencies such as the Department of Health, the Department of Human Services, the judicial system, and other community-based behavioral health services to address the care needs, medical treatment plans, discharge support, and appropriate placement of persons with behavioral health challenges. Behavioral health challenges generally refers to mental health and substance abuse disorders, life stressors and crises, and stress-related physical symptoms. JFL Emergency Department Behavioral Health Crisis Stabilization Services can be accessed voluntarily or through emergency commitment and/or involuntary commitment as outlined in the Virgin Islands Behavioral Health Developmental Disability Act. Involuntary treatment. A person experiencing behavioral health crisis can access behavioral health services voluntarily through the emergency department. The person voluntarily requesting behavioral health support is free to leave at any time after a behavioral health evaluation has been completed, unless the person appeared to be a threat to themselves and/or others or damage to property. In cases where behavioral health evaluation determined the person to be a threat to themselves, others, or damage to property, an application for emergency or voluntary commitment is initiated by the medical practitioner, psychiatrist for further behavioral health care and treatment. Emergency commitment. A treating medical practitioner, psychiatrist, behavioral health professional, relative, or anyone with personal knowledge of a person with behavioral health challenges who has threatened, attempted, or inflicted harm to themselves and/or another person and/or damage to property may file for an application under oath to the hospital for behavioral health evaluation of the person. If the treating medical practitioner, psychiatrist, determines that the person is a risk to themselves or another person or damage to property, the treating medical practitioner, psychiatrist can commit the person up to a maximum of 5 days, not including holidays and weekend, for continued medical treatment. After the 5-day period, the treating medical practitioner or psychiatrist must obtain a court order for further commitment, and the person may be transferred to another appropriate facility for continued care and treatment. Involuntary commitment. A treating medical practitioner, psychiatrist, behavioral health professional, relative, or anyone with personal knowledge of a person with behavioral health challenges may also petition the court for a person to be involuntarily committed for behavioral health evaluation and treatment. There is a court proceeding relative to the petition for involuntary commitment. Based on the court proceeding and decision, a person may be court-ordered, involuntarily committed for behavioral health evaluation and treatment. In these cases, JFL psychiatrists, medical practitioners, and staff work collaboratively with the court and the Department of Health to address the care needs, medical treatment plan. The person may also be transferred to another appropriate facility for continued care and treatment. JFL Behavioral Health Services. From April 2023 to April 2024, there have been 164 behavioral health evaluations, 60 emergency visits for anxiety complaints, and 49 with alcohol intoxication. Unfortunately, this data is not broken down by voluntary or involuntary commitments. The average census can vary from 1 patient to the full capacity of 4 patients. The therapeutic space designed for behavioral health space with patient-centered spaces such as therapy rooms, social rooms, outdoor space is equally important as the design in ensuring a safe and appropriate behavioral health environment. As mentioned previously in the testimony, the behavioral health area in the heart of the emergency department has 4 padded patient rooms, 1 bathroom, and a nursing station. The current behavioral health space is unsuitable for long-term chronic hospitalization or residential care. The limited behavioral health services in the community greatly impacts JFL. Therefore, the same patient often repeatedly need to be readmitted to the hospital for crisis evaluation and short-term patient stabilization. JFL behavioral health staff have been working with the territorial redevelopment team on developing a behavioral health space design for our new hospital facility. The proposal for the new acute behavioral health unit includes key patient-centered spaces such as therapy rooms, social rooms, and outdoor spaces necessary for a safe, modern therapeutic behavioral health unit. In addition, there are 2 pediatric rooms, 4 adolescents room, and 8 adult behavioral rooms for crisis evaluation and acute care short-term hospitalization. In closing, the JFL team thanks the Honorable Senator Ray Fonseca, Chairman of the Committee on Health and Hospital and Human Services, and all of the committee members for allowing us to provide this testimony today. We stand ready for any questions you may have.
Thank you for that testimony, CEO Cook and your staff. Next, we'll proceed to Ms. Webster from the Frederiksted Health Center. You may proceed.
Thank you. Good afternoon, Honorable Senator Ray Fonseca, Chairman of the Committee on Health, Hospitals, and Human Services, other committee senators, and all other senators in our listening and viewing audience. I am Ms. Iris Webster, the Chief Executive Officer of Frederiksted Healthcare, otherwise known as FHC. I'm here today to testify on behalf of the Board of Directors of Frederiksted Healthcare, our staff, and our patients. FHC is a nonprofit organization which provides primary care services on St. Croix. We are a community health center funded under Section 330 of the Public Health Service Act. We provide health services to everyone regardless of economic levels. The vast majority of the patients are underserved by the traditional healthcare system. Our mission is to provide non-discriminatory, evidence-based, affordable, and accessible health care to the community of St. Croix. We do this at our 4 health center locations where we provide primary care, behavioral health, and enabling services. Thank you for the invitation to speak today on the status of mental health in the Virgin Islands from Frederiksted Healthcare's perspective. We would like to begin by providing you an anecdote of our current experience regarding mental health in the VI. The Health Resources and Services Administration, otherwise known as HRSA, currently has a funding opportunity available to existing health centers to expand behavioral health services in their communities. Based on the priority points which HRSA is assigning for this opportunity, we believe we qualify for receiving this funding. If granted, we will expand staffing to increase psychiatric services, counseling services, and case management services for individuals with mental health and/or substance abuse disorders. While we are excited about the opportunity, we are struggling to write our application. The application requires an extensive discussion of the prevalence of mental health conditions and substance use disorders within our service area. It requires the number of people without access to mental health and substance use disorders and the most significant barriers to accessing mental health and substance use disorder services. The problem is that little to no data exists to quantify the size and scope of the problem faced in the Virgin Islands. The Healthy Virgin Islands 2030 Community Health Improvement Plan, issued in 2022, lists behavioral and mental health as priority 3. However, a review of the goals and objectives under that priority list more than 1,000 times, and I quote, "no baseline available," end quote. We simply do not have reliable data to tell us where things stand. Understanding the needs of vulnerable children and families in the U.S. Virgin Islands post-Hurricanes Irma and Maria in 2019, the Caribbean Exploratory Research Center noted the lack of morbidity and mortality data and the need to rely on secondary data from either, quote, dated information retrieved from online sources or estimates from the Central Intelligence Agency World Fact Book of 2018, end quote. As we have heard today, we are all aware of the presence of mental health and substance use disorder conditions in our community. Yet, we know almost nothing about it. We do not have estimates of prevalence or an understanding of the most frequently diagnosed types of mental health conditions, or even what the suicide rate is in the Virgin Islands. The World Bank indicates for suicide mortality in the U.S. Virgin Islands, quote, "no data is available for the specified locations," end quote. This lack of information makes it difficult for the government and individual providers to make data-informed decisions about the type and amount of care needed. We urge the committee to consider this knowledge gap and identify a path to close it. Even if we cannot measure them, one place where we all see the impacts of mental health and substance use conditions is in our streets. Far too many individuals with mental health and/or substance use conditions are unhoused, hungry, and ignored. It is easy to place the blame on the unhoused themselves. However, we all know that homelessness is not a choice. The National Institute of Health indicates 76% of individuals who are unhoused have a mental health condition. FHC provides services for over 100 unhoused individuals annually, both at special clinics for the unhoused individuals and during our regular office hours. Our special clinics give us the opportunity to provide personal hygiene, clothing, and food in addition to health care. We not only provide primary medical services, we also provide mental health services and are seeing significant successes in this area. Several patients have come to us completely nonverbal and are now speaking and communicating effectively. Others are now living in stable housing and are now holding jobs. While these successes are real and important, they are simply not enough. We do not have the resources in the community needed to expand on these successes. The lack of inpatient psychiatric care on the island of St. Croix is in itself a crisis. Outpatient mental health care is not equipped to handle psychiatric emergencies. Although we do our best to help those we can, the lack of key mental health services puts not only the affected individual in immediate danger, but also our entire community. We must move expeditiously on establishing this long-planned inpatient facility. Our community must also move expeditiously to add housing that is available to the unhoused individuals. This means adopting extremely difficult to recruit psychiatric providers. We currently only have a psychiatrist 1 week a month. These services are only available via telehealth. Behavioral health counseling positions are just as difficult to recruit. We are currently considering changing our staffing model, including increased use of telehealth and the use of dependently licensed social workers for counseling. If we are successful with our grant application to HRSA to expand behavioral health services, workforce issues will be a significant barrier to implementation. We are aware of discussions with Morehouse School of Medicine concerning placement of residents on St. Thomas. We are interested in participating in this or other projects that could address our provider shortage. Perhaps FHC could provide outpatient clinical experience for psychiatry residents. Successful pharmacological treatments of mental health conditions struggle with access to medications. Certain medications, for example, Adderall, require the use of a printed prescription, since electronic prescriptions for controlled medications are not allowed in the Virgin Islands. This creates an added level of bureaucracy as our psychiatrist provides services via telehealth and the patient is rarely at the health center. Printing the prescription and getting it to the pharmacy takes time and coordination. Research indicates electronic prescriptions have curbed prescription errors, facilitated monitoring of prescribed controlled substances, increased safety, and reduced possible abuses. The use of electronic prescriptions provides a complete record of each controlled substance prescription, from the physician through the pharmacy to the patient, supporting monitoring of all three phases of the transaction. We urge the legislature to take up this cause and reduce this unnecessary burden to the prescription of valuable medicines in treatment of mental health and other conditions. In addition, access to long-acting injectable antipsychotic medications has been difficult due to the charges for these medications. These medications, for example, Acetata and Invega Sustaina, have been approved by the FDA since 2015 and 2014, respectively. There are significant advances in the treatment of schizophrenia that improve outcomes without the many negative side effects of older medications like Haldol, as was shared earlier. By providing individuals with an effective medication that is long-acting, many individuals who once had debilitating symptoms are able to lead normal lives. There is no doubt that these medications are costly. However, an article, The Economic Burden of Schizophrenia, indicates that the excess direct and indirect costs associated with controlled schizophrenia is approximately $90,000 per untreated individual per year. To continue with the older medications may be penny wise, but it's definitely pound foolish. Ensuring these medications are available not only saves lives, it saves money. At this time, I'd like to thank the wonderful staff at Frederiksted Healthcare for all that you do for our community, And I'd like to thank you and the listening audience to affording me the presentation today. We look forward to working with the Committee on Health, Hospitals, and Human Services to expand access to care for both mental health and substance use disorder conditions in the Virgin Islands, and I'm available for questions. Thank you.
Thank you, CEO Ms. Webster. One question that I have, because what I am seeing is actually the back. So right in between the Honorable Commissioner Avril George, Human Services, and you, Ms. Webster, there's another person. I can't identify that person. I know Doug Cook is on the other side, but have we received all the testimony now? Can you respond, Commissioner George?
Commissioner George, next to me is Assistant Commissioner Ruben Malloy, and I think you received their testimony from Department of Health already.
Okay, good. Ruben Malloy, how are you doing? How are you doing? Okay, good. Madam Clerk, are there any other testimonies received for the record?
Yes, Mr. Chairman.
Okay, you may proceed with that testimony. And
good afternoon. Statement of Winnie Testamark, Director, Virgin Islands Bureau of Corrections, status of mental health, Committee on Health, Hospitals, and Human Services, 35th Legislature of the Virgin Islands, June 5th, 2024. Good morning, Chairman Fonseca, esteemed members of the Committee on Health, Hospitals, and Human Services, fellow distinguished members of the 35th Legislature of the Virgin Islands, and our attentive audience. I am Winnie Testamark, the Director of the Virgin Islands Bureau of Corrections, referred to as the Bureau, or BOC. I express gratitude for the opportunity to provide testimony regarding the state of mental health. To provide a comprehensive overview, allow me to delineate the mental health landscape in the Virgin Islands, particularly within the correctional system. In September 2016, the Virgin Islands declared a state of mental health emergency, a situation exacerbated by the devastation wrought by Hurricanes Irma and Maria in 2017. Upon assuming office, Governor Bryan extended this emergency state by Executive Order 486-2019 to facilitate the Department of Health's access to federal resources and widen its search for qualified mental health professionals. This ongoing mental health emergency significantly impacts the operations of the Bureau. Nationally, prisons and jails have become the primary institutions housing individuals with severe mental health disorders, making correctional facilities pivotal in addressing mental health concerns. Notably, the largest mental health facility in the United States is a correctional institution. Consequently, the Bureau of Corrections has become the primary providers of mental health services in the territory. Presently, approximately 40% of inmates within the Bureau facilities receive some form of mental health treatment. According to the National Alliance on Mental Illness, NAMI, between 25% and 40% of mentally ill individuals in the United States will experience incarceration at some point in their lives. To address this need, the Bureau currently engages a part-time psychiatrist and contracts with a local psychiatric provider to deliver mental health services for inmates across both islands. While the Bureau continues efforts to fill mental health vacancies, it is noteworthy that mental health services have been consistently provided without interruption. In July 2023, the Bureau inaugurated a dedicated mental health unit for inmates with serious mental illness in BOC custody. This achievement marks a significant milestone, facilitating prompt intervention and comprehensive treatment for mentally ill inmates. Spearheaded by Dr. Linda Callwood and Dr. Avadni Sang, this special unit offers enhanced treatment options and a therapeutic environment conducive to inmate rehabilitation. It is noteworthy that this unit is the first of its kind in the Caribbean and can accommodate inmates diagnosed with mental illness or major developmental disabilities resulting from clinical or behavioral risk factors. While individuals with mental health disorders are disproportionately represented in correctional facilities nationwide, the Bureau remains committed to ensuring that they have access to adequate mental health treatment. Currently, the Bureau offers a quality program in which our inmates and detainees can improve as people and prepare for release through a variety of one-hour sessions, including but not limited to drugs and alcohol, law awareness, trauma, anger management, conflict resolution, and independent living. These sessions reflect a learning process for these individuals, wherein they can disclose their feelings and provide their opinions based on the topics presented. The unit's first cohort of 10 participants offered extensive insights and happenings of the program, as well as how it helped them overcome some of life's obstacles. Also, the dedicated mental health unit offers a day treatment program, which is a comprehensive, structured program designed to provide intensive mental health care for individuals who require more support than traditional outpatient services but do not need full hospitalization. The program is tailored to meet the unique needs of each participant, offering a blend of therapeutic services and medical oversight in a supportive environment. At the heart of our day treatment program is a dedicated psychiatrist, Dr. Avadni Sang, who plays a crucial role in the treatment process. The psychiatrist conducts thorough initial evaluations to understand the specific mental health needs and challenges of each participant. Based on these assessments, they develop personalized treatment plans that incorporate both medication management and various therapeutic modalities. Let's see. Basic merit. Okay. Hold on. Where am I? Moreover, the Bureau collaborates with the Virgin Islands Equestrian Equine Therapy Project, Inc., VIEETP, to administer the Elite Program, a horse care and training course to qualifying inmates at John Bell, led by Ms. Chantel Cormanboof, an experienced equine trainer and rehabilitation specialist. This program aims to equip incarcerated individuals with employment skills and facilitate equine-assisted therapy with the overarching goal of reducing recidivism and enhancing post-release employment prospects. Equine therapy, also known as equine-assisted therapy or horse therapy, is a form of experiential therapy that involves interactions between individuals and horses. It's often used as a complementary treatment for mental health issues such as depression.
Motion, Mr. Chair.
Motion. Yes. Motion. Proceed, Vice Chair.
Mr. Chair, I move to waive the reading of that testimony from the Bureau of Corrections. I so move.
Okay.
And it's being seconded here in St. Croix.
I didn't hear who's second. Can you repeat that?
Second, Senator James.
Okay.
Maurice James.
It's been moved and properly moved by Senator Gittins, second by Senator Maurice James, to read the testimony, waive the reading of the testimony from the Bureau of Corrections. All in favor? So ordered. Okay, so colleagues, hearing no objection, so ordered. Colleagues, we're going to proceed with a round of seven minutes. Yes, thank you, Mr. Vice Chair. We're going to proceed with a round of 7 minutes. We're going to start with Senate Vice President Blyden, followed by Madam Rose Chair, Senator Capehart. So Senator Blyden, you're recognized for your 7 minutes.
Thank you so much, Mr. Chair. Good afternoon to my colleagues, viewing, listening audiences, staff, central staff, and good afternoon, especially to the testifiers. It's been a long day of testimonies, 4.5 hours. It was pretty long, but necessary. As the chair stated, last month was Mental Health Awareness Month, and this month is Men's Mental Health Awareness Month. And I just want to state for the record, in respect to men, men don't like to even go to the hospital, much less, check on the mental state of mind. And I would encourage my fellow males to do such, because it's important. Again, I want to commend, as a matter of fact, all of the testifiers for their recommendations, sharing their experiences with us, and I want to commend them for what they do on behalf of our people in the territory when it comes to mental health. The services they provide, and the like, to include the hospitals, the healthcare centers, and all other organizations and non-for-profit organizations. Here in our territory, and when it came to the testimonies, we heard some of the same things from many of the testifiers in respect to training of our police officers, school monitors, teachers, and other individuals in terms of awareness. And also we heard of funding for the non-for-profits to assist in the operations, funding for the hospitals and other facilities. And we also heard of grant funding, and some of the testimonies spoke to applying for and going through the process right now. We also heard of different programs that's going on right now, like the Suicide and Crisis Lifeline Project, the Crisis Intervention Team that they have, and also several other programs. But I honestly want to speak to two things. Number one, the data that Ms. Webster spoke to, and that is critical, because without data drives policy, and without data, really much cannot happen, or we might not be getting the right amount of funding that we need. And I was wondering, in terms of data and all of the different organizations that deals with mental health, from their different agencies and organizations, how do you guys share the data? Is there a registry? Can someone speak to that for me briefly, please? I'll talk to someone from the government. Assistant Commissioner Sims, I'm speaking to you. How are we sharing the data from all of the different organizations and agencies? How?
So at present, and I'll start and I'll actually kick it over to AC Malloy. At present, we collect data independently. Unfortunately, it's still very much siloed. When it's shared, it really has to go through some of the committees that we've developed to tackle the mental health issue. However, one of the broader scoped missions that's coming out of the government of Virgin Islands is a data warehouse. It is designed to do just that. So I can have AC Malloy briefly explain how impactful that data warehouse will be.
Please.
Good afternoon, Ruben Malloy, Assistant Commissioner, Virgin Islands Department of Health. Yes, the Department of Health has received $2 million to establish a territory-wide universal data warehouse, which will, from claims from private and public carriers, being submitted by the providers in the territory, will be able to provide data on the population of the Virgin Islands. And it will be based on ICD-10 sort of information, which provides information on diagnoses, procedures, and social determinants of health type data. And you will be able to determine prevalence of diseases, chronic diseases, and also all other sorts of data, and it will help us to be able to do strategic planning and targeted strategy to, for example, we can determine what services are being exported out of the territory, being provided out of the territory, and strategically planned for those services to be stood up in the territory to stem the tide of revenues generated in the territory from the government being the largest employer and Stigma dollars going outside the territory and have it be kept in the territory and be circulated for healthcare services.
Okay.
Enhancing healthcare services.
Okay, very well. Briefly, when did you receive this $2 million and where we're at in terms of assuring that we utilize those funds? Can you briefly?
We received those $2 million in what was it, December of last year.
1 minute.
No, I'm sorry. It was December previous. It was around early 2023. Where we are right now is we've selected a vendor. That vendor is Health Tech. We've convened a technical stakeholder meeting to start the project. And we're starting with the Medicaid MMIS, and then we go to the Pharmacy Benefits Manager Program, and then we go down the line in sourcing data from the other providers in the territory.
Okay, very well. Assistant Commissioner Malloy, as we are starting, we do have a crisis, so I just would like to see more aggressiveness when it comes to this space because it's very important and very critical. And before my time runs out, let me ask finally in respect to Mr. Chair, can I? There's one testimony that really got my attention though, which covers several of the other testimonies in a nutshell. Dr. McCormick, she spoke to the $7 million that's being diverted annually out of this island of island treatment, and she spoke many times in her testimony about psychiatrists and having them on board, and she also spoke to Babel Plata several times. I heard that mentioned. So can you briefly focus in on that part of your testimony too, so we can really have a better understanding of exactly what you're speaking to, and also you spoke to not only the problem, but you spoke to the solution in your testimony in respect to mental health and what the solutions are. Can you speak briefly to that, please? I'll really appreciate that. Thank you so much. Please recognize the mic of Dr. McCormick.
Thank you for asking for clarification.
Yes, please recognize the mic for all the testifiers.
Thank you for asking for further.
Media recognize. Oh.
Yes.
Okay, the Committee on Health, Hospitals, Human Services stands in recess for 1 minute. The Committee on Health, Hospital, Human Services is back on the record. Vice President Marvin, Psychiatrist Laurie McCormick, please respond.
Thank you.
How am I still out?
Thank you for.
Go ahead, Tess. Test. Okay.
I think this one is working.
Yes, yes.
Thank you for the question, Honorable Marvin Blyden. I appreciate you asking for more clarification on that. One of the things in my written testimony that I didn't mention before is that when I first came in 2013, there was a consent decree against the U.S. government, U.S. Virgin Islands government, for mental health violations and also for the Bureau of Corrections. And it's not a surprise that both of those would be tied together, as we know that there's lots of data suggesting in many other countries that when a society doesn't care for its most vulnerable, the severely mentally ill, the prison population goes up. And once we do take care of our most vulnerable, then our prison population goes down and we're able to take care of them in the community. In that consent decree, there was a very comprehensive 5-year strategic plan, and that came from Professor Higginbotham from the UK, working with the National Health Service, the NHS in the UK. And it's an excellent model in which to bring back, at that time, $5 million. My understanding is that the current budget for mental health now is $7 million, and virtually all of those dollars, there's always a deficit each year, but all of those dollars go to pay for 44 severely mentally ill with sociopathy who have committed crimes and have been found not guilty by reason of insanity that are being housed not in the U.S. Virgin Islands stateside. So our people and that $7 million is not being used here on island. I was saying that there is a locked unit facility, Eldra Shelter Grant, that I think would be good to hear more information about that facility and the beds. But it's my understanding that there's at least 40-some beds there, and there's a whole wing that has been shut down from after the hurricanes. But that would be a place to bring some of those 44 severely mentally ill back. And each time you bring one of those back, that's another $300,000 to $350,000 each per year. And so if you have some funding put in for even just one community mental health psychiatrist to begin with, at least in St. Thomas, where Eldra Shelter Grant is, then that person can hold the involuntary commitments for many patients that are in Eldra Shelter Grant currently that could be taken care of on an outpatient basis, as long as there was somebody there to hold the involuntary commitment for one, and then to see them on a monthly basis to make sure that they're taking their medication and staying safe. And I would emphasize again that many, many patients with severe mental illness, once they're on their medication, they're quite well, and they function quite well, and they can be back in society, living with family members or sometimes even on their own. But it makes there's a world of difference between a person who has severe mental illness when they're on their medicines versus when they're not. And it's really quite a tragedy that for all these years, there's so many patients, so many people with severe mental illness with just zero access to care. One of the important things to point out as well, so that funding, which is really quite a small pot of money, relatively speaking, to put in for a community mental health psychiatrist to do that, that psychiatrist on their own is going to bring in about $300,000 to $400,000 a year on their own, in addition to bringing that money back for each person coming back that's being housed in the States. In addition, that money can then be put into hiring billers and coders, so now all the licensed professionals involved with the care, even including nurses giving the injections, social workers giving therapy, all of those people now can bill for their services, which they're currently not. It's also my understanding that being a locked unit, they've without having a psychiatrist there is not only not really ethical in a sense, because patients on these antipsychotic medications really do need to be evaluated, Because if they do develop some side effects, so a common side effect to an antipsychotic would be tardive dyskinesia, where there's this really grossly disfiguring movement that can happen from being on too high of a dose of medication. If that's not caught within the first 6 months, that becomes permanent and it's really hard to treat. But if patients are seen on a regular basis, we always monitor for that and would reduce the medication and always prevent that from happening. So I think the important thing is it's not just bringing back our money and bringing back our people who need to be treated here in the territories. Is we're really missing out on a lot of opportunity to bring in money for the psychiatric services, counseling services, and then also to get the CMS money from Medicare, the Centers for Medicare Services, because we were in violation, and it's a violation to have patients in a locked unit on antipsychotics that are not being evaluated within 14 days of starting a medication, within the first 6 months, and then annually. That is a huge violation, and we've lost those federal dollars.
Thank you. Point of information.
Vice Chair Gittins, you're recognized for your point of information.
Thank you, Mr. Chair. I believe Assistant Commissioner Malloy from the Department of Health was asked by the previous speaker about the ARPA funds that they received. And I'm thinking back that I don't recall hearing in the testimony anyone giving specific information to the 2019 state of emergency regarding the mental health status here in the territory. And that was specific to facilitate and assist both hospitals and the Department of Health in hiring mental health professionals, and also suspending the law to be able to allow for the rehire of retired doctors. Through the chair, since we didn't hear anything on that, I'm just asking from both hospitals and the Department of Health whether or not anyone was actually hired in that time. We are now in 2024, and these monies are expected to expire, I believe, in 2025. How many persons were hired for behavioral health, whether doctors or other positions?
Will Mr. Assistant Commissioner Sims and Tina Commission and Mr. Cook, can you respond in that order?
So in terms of the funding that was provided for the hiring.
Please put your name and title on the record.
Nicole Cragwell Sims, Assistant Commissioner, Department of Health.
And Mr. Chair, if you could have them be succinct. I just want to know how many people were hired or who were hired, what positions. If there were none, tell me none. I don't want to hear a long story today.
Yes, Assistant Commissioner Sims, proceed.
So in terms of the hiring, while the department has brought in individuals, it has not been directly linked to the ARPA funding. That particular hiring process is still a process that we're working on with the hospitals in terms of hiring and our HR divisions.
Okay. The answer is no. Next.
Good afternoon, Tina Commission, CEO of Schneider Regional. To my knowledge, we did not have specific funding for the hiring of those professionals, but we have, through our operational funding, hired psychiatrists since that period. We had Dr. Maservi as a full-time psychiatrist working with us for a period of time. When he left, we have rehired a new psychiatrist, Dr. Smith, who's on board with us, and we are engaging a second psychiatrist who is going to be working in our wellness clinic, but I'm not aware of specific funds that were designated to Schneider for that purpose.
And CEO Cook?
Good afternoon, Doug Cook, CEO of JFL. Concur with Tina Commission. We do not have knowledge of specific funding through the ARPA funds specific to mental health. However, we do have Dr. Sang, a psychiatrist on staff with JFL, and we continue to hire nurses through our emergency room to support our crisis intervention unit.
You know, colleagues, this is exactly why we need to review previous testimonies and what's told to us even 2 and 3 years prior, because in this same very committee back in, I believe it was 2022, we were told about the $1.4 million in ARPA funds that will be allocated to the behavioral health and drug dependency services to hire these personnel. To date, we're hearing now again that there has been no hires. And again, these monies are set to expire September 30th, 2025. We can't continue to kick the can down the road like this. This body also, and I'm pretty sure that the president, when he speaks, is going to speak to it as to how much monies that we have allocated to do the rebuild of the Anna's Hope Detention Center so that we can address this. Again, we can't continue to kick the can down the road on this issue. Thank you, Mr. Chair.
Yes, thank you, Mr. Vice Chair. Assistant Commissioner Sims, you had some additional information?
Yes,
Proceed.
I do. So the department, Nicole Caldwell Sims, Assistant Commissioner, Department of Health. Department of Health stands corrected. We actually did have some hires. We have a psychiatrist, 2 clinical therapists, and 2 case managers, as well as a case management planner. So that's about 5 total positions.
Okay, I just want you to be a little bit more specific. You had hires. Are they still currently on the staff or they've left?
They are still currently on staff.
Okay, I want to follow up on what the statement from Roy Snyder Hospital, whereas they mentioned the released patients, they need follow-up, and also the second generation injectable. So tell me now, when a patient is released, what psychiatrist is now seeing them? They're no longer with the hospital. What's going on? Recognize the mics for all the testifiers, media, please.
Tina Commission, Schneider Regional. Thank you, Senator Fonseca, for the question. We often have a difficult time of having that community follow-up for the patients after discharge. We do try to come up with a very comprehensive discharge plan for them before we discharge them. It's part of the reason why we saw the need to institute our own wellness clinic, so that when we discharge patients, they can get that very necessary follow-up. So some of that is happening with us, but we know that there's a need for additional providers and psychiatrists in the community so that patients can get the care they need and not be part of a revolving cycle of coming back to the emergency room. And some of the other things we mentioned, including housing options, are really important for breaking that cycle. You know, say housing is healthcare, and if you discharge a patient and they don't have a good plan, they don't have a stable housing situation, very frequently they'll decompensate and end up back in the emergency room. So we need more community support so that we can successfully discharge our patients and help to break that cycle. Thank you.
Okay, I have a point of information from Senator Marvin, but before I go to him, I want to follow up because it seems it's apparent from the outset that there's a shortage of psychiatrists in the Virgin Islands, and we received testimony from Dr. Laurie McCormick here. So I'm going to ask the Department of Health. I think Human Services, you can chime in here. But right now, it seems like there's a lack of adequate psychiatric coverage on St. Thomas since the retirement of Dr. Liu and Dr. Spencer. We all know Dr. Liu and Dr. Spencer worked, brilliantly here for many years now. So I'm asking, who has been hired to replace Dr. Liu and Dr. Spencer? Commissioner Sims, Assistant Commissioner Sims.
I'll turn it over to DC Steele.
DC Steele. Name and title on the record.
And Steele, Deputy Commissioner, Public Health. So since of January 2023, we actually added Dr. Robin Brannigan to the team, and she services the St. Thomas Clinic. She not only services Barbell, but she also services ESF. So it's probably a need of a little more exposure or knowledge to be shared, because that's been going on since 2023 of January. She's been with us. Currently, she comes to the territory 2 weeks out of every month on the ground, and the other time she's available through telehealth. So Dr. Brannigan's service is the St. Thomas district.
So you see, you had 2 full-time psychiatrists left, and now you hire them with 1 half-time, part-time psychiatrist. Okay, Senator Marvin Blyden, you're recognized for your point of information.
Thank you, Mr. Chair. It's just a follow-up to my fellow colleague line of questioning in respect to the funding, the funding. 3 quick questions. What was the amount of the APRA funding? How much has been spent so far, and when does it expire? That's my question. Thank you.
Response?
Yeah, we'll have to get on from CFO is now with us today. We'll have to get the exact breakdown from them, okay?
Okay, Senator Caput, you're recognized for your 7 minutes. Media recognize the mic for Senator Caput.
Thank you, Mr. Chair. First, I want to say I commend you for bringing all these testifiers today to talk about the behavioral health condition in the Virgin Islands. As we hear these numbers today, I was so taken back when I hear the St. Thomas East End Medical Center stated that 18% of their patients that are seen at the Center for Behavioral Disorders with over 3,000 visits. That's alarming. And I just want to get a little more understanding, because I understand there are different types of mental illness. Can Department of Health or Human Services tell me what is the most severe form of mental illness, and what are we seeing mostly in the territory? Mr. Steele, can you answer that?
Brennan Steele, Deputy Commissioner. Well, speaking specifically in the Department of Health, the highest level of mental illness that we see that what would be classified as high risk is your individuals with schizophrenia, those individuals with delusional disorders, those who are actively in any kind of psychosis. Secondary to that, we do see those in bipolar, where you have manic and depressive state. But the most prevalent diagnosis still is depression in the community, and that's also seen across the national spectrum. But in our clinic, we tend to get what we call the high-end psych, so we get a lot of schizophrenic patients coming to the outpatient clinics.
So there's a schizophrenia treatment that is offered for these individuals when they come to Department of Health?
Yes, that's what Dr. McCormick was referring to earlier. Those are treated with antipsychotics, and that's where she was talking about the long-acting injections such as Invega and Haldol, Decanoid, and so forth. So currently in the territory, it's almost the easiest to get the Haldol, as well as we get Prolixin in our clinic, but it's we have to get prior authorization when we try to go and get stuff like Invega, and that's what Dr. Brannigan and Dr. San has to do.
So I've had the opportunity with the chairperson to actually visit some of the long-term facilities with you, Mr. Steele, where we visited Sunrise Community, we visited Devereaux. The places that we visited, we saw our Virgin Islanders there. And it was real sad and still good to see that they're in a facility being taken care of. So colleagues, this is why we need to work collectively on legislation, support the legislation that I even have for long-term residential care, because when we were there, as the state that they're in, they know when they heard that we were from the Virgin Islands, they were like, I want to come home. I want to come home. One was like, I want the foods from home, and one starts singing music jamban. I mean, tears came to some of our eyes because these are our people who are away and want to be home. Even though they're in that state, they want to be home. So it's very important that we start working collectively on long-term chronic facilities, residential care for our people that are experiencing mental illness. And I just want to know, like, how long is residential treatment? Could it be forever or based on medication? There's a period that, okay, this person is good, that they can come back home. Is there any of those good stories?
We've had some of those stories, but to just briefly cover the process, there's, in an ideal situation, there's different levels to care. So an individual might go through the system starting acute services, having to be admitted, whether it's involuntary, voluntary, or just coming in for assessment. If they're stabilized, they go straight back to community. If they're not stabilized, they would go to an inpatient level of care. That inpatient starts reviewing every 90 days. If someone is now stable in that 90 days, they're supposed to be discharged back to community as well. Somebody might need a higher level of care, as they would say, or is medically necessary to refer them to a different level, which meets their need at that individual. They may go to a facility up to 12 months at that point, and then they're again supposed to be reviewed every single 90 days while in residential to verify, do they still need to be at this level? We in treatment always talk about the least restrictive environment for individual in treatment, so we always have to take that into consideration. Even with the cases we currently have in the territory with the Department of Justice, that's why we have to go to court with status updates, and we provide reports, and we follow them monthly with the case management treatment team, because we have to justify why they still need that level of care if necessary. And after that time, if you go long-term care, you're expecting to see, by definition, traditionally long-term you're seeing 2 years, but we have turned long-term because of limited resources into permanent. Individuals supposed to transition through that and be able to go back ultimately to community, unless those who have intellectual disability and stuff who are not able to go back might go to a group home setting.
So, Mr. Steele, can you tell this body today, like, how many of Virgin Islanders are at off-island facilities, and how much does it cost for each one of those individuals per year, per month?
Okay. Just to give the numbers, as we testified today, we have 48 residents currently out of the territory. 22 of that 48 is NGRIs, not guilty by reason of insanity, so they fall under that forensic / spectrum. 15 is just in chronic care, and 11 is specifically in the intellectual disability category that we talked about. Most of the intellectual disability ones have been those who aged out from DHS system when they were minors, and they're still there. Okay, so Department of Health takes custody at 18 years of age. Just to give a cost estimate, for example, our stabilization facility, Larkin in Florida, you're talking about anywhere from $1,100 a day for an individual to be there, with the expectation within 6 months they're out of Larkin. They don't keep them for long term. Devereux facility has a running rate that'll be $575 a day currently. And then facilities like Correct Care and those that's forensic based have a slightly higher cost. They're running about $600 a day right now for the forensic population. Sunrise is one of the lower ones, and it's about $422 for that intellectual disability population. But the advantage of a facility like Sunrise, those individuals, because it's not classified as a psychiatric treatment facility, it's more of a group home for that individual, they're able to apply for benefits within the state of Florida, and then we offset the cost with their benefits to reduce that cost.
Okay, thank you. Mr. Chair, if I may just conclude with one question.
Yes.
Opioid, what is the status in the Virgin Islands? Should we be alarmed? Are our numbers getting higher? What are we doing as a territory to prepare in the event that we start seeing more opioid cases?
Currently, the numbers are still there. It hasn't been, of course, to any national levels. We've had reported in 2023, I believe, was suspected of 4 deaths tied to opioid use in the Virgin Islands. We know there's many cases out there that we're not aware of because the individuals can go quite some time using without realizing the effects, so don't reach to the point needing overdose. In the interim, the Department of Health has been working with our internal EMS and fire EMS services. We've done training in naloxone training, which is the recovery medication for anybody overdosing or opioid use, as well as we transitioned our methadone clinic over to buprenorphine, which is a new and more advanced treatment form of treating opioid use disorder. So we've transitioned our previous methadone clients over to newer treatment modalities. And we're currently in the process of identifying through the settlement that's been established for the government, we're setting up that opioid task force and plan to enhance not only the awareness, but treatment options for that, and in collaboration with like the village and other facilities to expand substance use treatment.
Thank you, Mr. Steele. Thank you, Mr. Chair, for your leniency.
Yes, thank you, Senator Capehart, for that line of question. So I got to go back to Deputy Commissioner Steele. Oh, by the way, I have to give you credit because the committee with yourself did tour the facilities in Florida, like Senator Capehart. And as a matter of fact, part of the reason why we have Bill 350224, the mobile health vans, is because of you, Senator Capehart, was able to put it together. So it's very, very well. The committee has not been able to schedule a trip with the Bureau of Corrections. And of course, the Bureau of Corrections didn't show up today. But the 48 patients that you're talking about, you said one of them alone would be as much as 1,100 hours per day.
That's correct.
Okay, if you multiply that, by a year, that's $401,000 potentially for one patient to treat. Now, we received testimony from Laurie McCormick. You're a licensed psychiatrist in the Virgin Islands, is that correct? Dr. Laurie McCormick? Okay, and you said that you may have been interested in a position and they were offering how much? The VI government was offering how much?
$90,000.
You see that? So we have a board-certified psychiatrist practicing in the Virgin Islands. The government is offering her $90,000, but we would pay up to $401,000 for one patient for 1 year in the States. Well, Sapopa. The numbers don't add up. So let me ask you, Department of Health, what is the budget for your psychiatrist? What is the salary you're offering for your psychiatrist right now?
Currently, both psychiatrists are on a part-time salary, and it's $140,000.
140. So you see, the numbers them don't add up, because when we visited the facilities in the States, in Florida, and I have to say, they were well taken care of. However, their main concern is that they want to come back home. They miss the jamban and the carnival and all of the local fruits. So it's very important that we can retain psychiatrists. If we actually have a psychiatrist in the Virgin Islands, we have to be able to offer them a good salary. Tina, Commission at the hospital, you've hired 2 psychiatrists. What salary are you offering the psychiatrists? Because we have a need. We've established that we have a need for more psychiatrists. And if we're paying millions for patients off island, maybe we can resolve that. What are you offering, Tina? And Mr. Cook, CEO Cook, I want you to answer that also.
Yes, Senator Fonseca. So for our psychiatrists who provide call coverage and do a little work in the clinic, the salary is in excess of $200,000. I don't have the exact number in front of me, but I'm happy to provide that to the committee after the hearing. Thanks.
Okay. CEO Cook, what are you offering your psychiatrists?
Good afternoon, CEO for JFL. We have 1 psychiatrist on staff. I believe the current salary for that individual is $140,000.
Okay, that's still a big difference. So either way, right, we're learning today that we need to retain psychiatrists, and definitely we need to offer a competitive salary. Yeah, and hire more. One of the questions I wanted to ask in the mental health, I noticed the director, she had to leave early. And I know that, I've only been a senator for 1 term, and I think this is the 3rd mental health director. The mental health director is like the WAPA CEO, Popa. They got like a rotating wing with the mental health director and the WAPA CEO. So, do we have current vacancies in the budget now for psychiatrists and psychologists at the mental health? I'm talking about the facility in Barbell Plaza.
There's no current vacancy that's budgeted for the psychiatrists, no.
Okay,
We're
so I
still
know-
we're seeking additional funding at this moment, specifically for expansion of psychiatric services. And as you heard earlier, we mentioned we've been trying to reach out to a university who's planning the residency program in collaboration with us.
Okay, well, Dr. Lu, who retired here X amount of years ago, he used to be down there in that clinic. So who has replaced Dr. Lu seeing patients down at the Barbell Plaza Clinic?
Dr. Brannigan.
Dr. Brannigan. And that's the same one that does the 2 weeks a month?
Correct.
Okay. Okay, so next we're going to go to Senate President Novell Francis. You're recognized for your 7 minutes.
Thank you very much, Mr. Chair, and good afternoon. I too want to join in commending you for this consortium of individuals that we have put together here to have this discussion regarding behavioral health. Because we like to stay away from the mental health discussion, right? The behavioral health component in this community, and to get a perspective of where we're at with this. I've been at this for quite some time, and I appreciate the work that have been done because a lot of times we criticize and complain when we don't have enough, and all of the challenges that we do have, and rightfully so at times. But I want to say, in the absence of that, we would have been so much further. So I truly appreciate the work that has been done thus far. I also want to say that I've provided $3 million to the Honors Hope facilities for the upstart of Honors Hope facilities. We provided $1 million for mobile vans to go out into the community and be able to meet the clients where they're at. And a lot of the discussion today surround this very same theme by all of the individuals that have been here today in respect to some of the challenges that we continue to experience. I believe that if we could really collectively put our heads together and a plan, that we could in fact make some inroads in this problem that we're experiencing, because this in itself is an epidemic that we're experiencing in this community. We hear from the Project Health Center that we must move expeditiously to address this particular issue. We heard from others in regards to the lack of available and consistent wraparound services for treatment. There's a lot of that discussion here today. Myself and my colleague, Senator Fred Gregory, and other colleagues are working towards providing some additional funding at the tune of $15 million from the Epstein estate to put towards behavioral health in the immediate future as well, which will be, again, go towards that comprehensive reform of behavioral health legislation that we passed recently, and we're hoping that could hopefully move the needle somewhat in addressing what we're seeing here today. I wanted to ask how many, we just had a discussion regarding that, but how many psychiatrists do we have in the territory as it stands right now? Anyone can speak to that exact number, regardless of whether they work for health, Project Health Center, any one of the component. How many psychiatrists do we have in the territory right now? Anyone that can speak to that? Mr. Steele, Assistant Commissioner Steele?
Not as a whole. I know we got 2 part-time at health. I know hospital you might want to share. And
I think, if I may, Nicole Craig-Wilson, Assistant Commissioner, I would say collectively it's less than 10. Why we don't have an exact number? The number doesn't pass 10.
Doesn't pass 10. And what about telehealth psychiatry? What are we doing in that space?
So the Department of Health utilizes, as mentioned, Dr. Brannigan. She utilizes our telehealth services to see patients, as well as the maternal and child health. They have a robust or building telehealth program. They also utilize telehealth services.
So let's talk a little bit about, go ahead.
Yeah, I wanted to
Ms.
share, at
Webster.
Frederick said Healthcare, we also use telehealth for psychiatric services. We have a psychiatrist, Dr. Ingram, who actually lives in Michigan, works in Michigan, and gives us 1 week each month. And I did want to add to the question about how many psychiatrists are in the territory. I was hearing corrections, JFL, and Department of Health speak about the same psychiatrists. I don't know if you realize that, but they all share the same Dr. Sang. So it might have seemed like 3 different psychiatrists, but it's one person doing all 3 jobs.
I'm very familiar with Dr. Flang and the fact that she's doing a lot, over the years. I've been dealing with her since I first got into the legislature. So I know that her and Dr. Liu at the time, and I know that we have not seen too many more since then. I wanted to ask about the crisis intervention team. Where are we with the crisis intervention team at this time?
Currently, the crisis intervention team is what's being developed. At the moment, we respond to crisis utilizing our same staff from the clinics. So it pulls away from services for outpatient services. In the process, we're trying to find and identify funding. We've put in for supplemental funding to try to build out that crisis response team. But right now, it's only the same staff being asked to respond accordingly.
So I previously served as the chair of Health, Hospital, and Human Services, right? And, we continue to have these circular discussions about, billing out and doing these type of things. And that's where we find ourselves, keep talking about this quote unquote crisis, but we still have not been able to lock this in. And that's why I say it's important that we already come together, sit in a room and hopefully try to come up with a game plan that we don't just, talk, but really be able to get some action taken. What is happening as it speaks right now if there is a manic episode? If you're called to a situation, can you walk us through how that's handled right now?
Currently, if we're called out to respond to a behavioral crisis, the team goes out, do an assessment. It's usually in collaboration, sometime with our internal peace officers and internal environmental health officers, also trained in CPI, support us. Other times it's directly with the VIPD, would also be in the scene to be able to intervene. If during that assessment we identify that person needs to be taken to the hospital for further review or go under a 1024, which gives emergency for commitment to at least be evaluated, then they would assist us in transporting them to Wang Louis or Snyder Regional in St. Thomas accordingly.
And once they get to the hospital facilities, what happens?
The hospital psychiatrist then evaluates those patients, and if they see fit, then they have them admitted. If they come in under the 1024 already, they would definitely hold them. It would be that 24 to 48 hours of observation, and then they can be discharged. If they recommend a higher level of care, then they do the 1026, which is then involuntary commitment petition to the courts, and then we go from there, and it's possibly off island or involuntary to Royalist to Snyder, as mentioned earlier.
So is the 1024 and 1026 the same as the 722 and the 723? Are
Correct.
we using those?
Correct.
Okay. Mr. Chair, if I just would
Yes, you
finalize
may.
with one follow-up. Just real quickly, I'm very concerned about the discussion in respect to those individuals as being flown in on one-way tickets and coming in here. I wanted to know because I would imagine that a lot of that end up with human services in some instances. Because of course, if Women's Coalition is saying, not me, they belongs to me, and others are saying that then it falls in the lap of human services. So can you tell me, are you seeing an increased number in that area as well? And how are you navigating that? Are we providing one-way ticket back for those individuals, or what's happening in regards to those individuals that's coming in?
Good afternoon, Commissioner Avril George. We recently had an incident about last month, month and a half, where we had an individual that came in via Port Authority, contacted us, one-way ticket, don't have no place to stay. We picked up the individual, was able to put them in a hotel and bought them a one-way ticket back the next morning. Came to find out the person was registered with a homeless shelter in Florida. How she got here, we don't know, but we try to get them back out to the destination they flew in, because if they stay here, they end up being our problem. It's cheaper to ship them back to where they came from than have them stay here with no place to stay.
Thank you very much. And Assistant Commissioner Steele, in regards to a public-private partnership, I mean, we continue to have this discussion about the lack of resources and funding and everything else that's associated with our inability to move the needle with behavioral health. Do you see an opportunity for us to enter into a public-private partnership with a time certain and being able to make some inroads in this area?
Absolutely. We're always open to public-private partnership. And we were just talking about that in general here with the whole team here, that we look forward to this ongoing collaboration because we've all realized we're all in the same boat and everybody's willing to do a part. We all provide a key service, but if we bring it all together and see where each one who does what best and we align that appropriately and then we won't overlap, we'll probably get a lot more done as opposed to each of us working in silos.
Thank you very much. And I want to say that, we're really doing this for ourselves in the future because we're all one episode away from behavioral health issues. So we're paying it forward. Let's get together and address this particular issue. Thank you very much, Mr. Chair, for the time and opportunity.
Yes, thank you, Mr. President. And, I just want to follow up on that, right? Because, we're all professionals and all of us, are doing an excellent job. I'm proud of everybody here. But I want to follow up on a comment from Ms. Stewart from Family Resource and Ms. Lewis from the Women's Coalition of St. Croix, and also Ms. Hairston from Nana Baby, because they all mentioned that they have mental behavioral health issues in their organization. So, for example, let's go to Ms. Lewis on St. Croix, the one person that came and sleep there. And in the night when the government closes, they come and they bothering you. What psychiatrist or what special access do you have to these services after the government is closed? We'll go through Ms. Lewis first, and then Ms. Hairston, and then Ms. Stewart. Answer those questions. What is your access to these government services?
Senator, we really don't have access to many government services.
Put your name and title first, Ms. Lewis.
I'm sorry, my name is Dr. Lewis from the Women's Coalition of St. Croix. We don't really have many accesses for government, especially after 5, because at 5 o'clock government closed down. So either we call the police, they might run them away, and then when we all go home, they come back. We don't have any access, and that's the problem. So what I'm trying to do is get funding so I can fence up my facility, get cameras and lights in so we can secure it for our clients that come through. But in the meantime, we just have to deal with it. A good example, I don't know if you heard me, one of them tried to set one of my buildings on fire a couple of weeks ago. He lit a shirt and threw it in the basement of one of the buildings. And thank goodness we had ADT and the neighbor that called the fire department right away. We don't have any access to anybody that can come and help. We have to deal with ourselves.
Thank you. Ms. Stewart?
Not really laugh,
Your
but
name and organization, yeah.
Anya Stewart Family Resource Center. It has been happening for a while. I listened to the commissioner for Department of Human Services said the easiest way is to purchase a travel ticket, but we did, and the following week that client came back to the Virgin Islands and she was at our gates. We called VIPD. When she see the vehicles, what she did, she escaped, she ran away. So it's a constant thing. They keep coming back. It doesn't matter what you do. We just really have to get together to find ways and means to keep them up.
Thank you. Ms. Hairston? Recognize the mic for Frankie Center, Frankie Johnson.
Testing. Hi, Darian Therese Harrison for Nana Baby Children's Home. Darian Therese Harrison for Nana Baby Children's Home. It's interesting because sometimes we are the resource in the middle of the night. That's part of the service that we provide to to the government, to the community. So we are 24/7, and we take children all hours of the night often. When we have our own crisis, it's a little different. We're instructed to call the police if we're having a behavioral issue or if we're having a mental health issue. One of my husband or myself, we take the child to the ER and then usually spend the night there. And we get some caseworker supports in the morning.
I think we're leading towards solution. I know this group needs to talk more so that we could have access to resources. Deputy Assistant Commissioner Sims.
Thank you. Nicole Cragwell Sims, Assistant Commissioner. I just wanted to put on the record that the interdepartmental committee that was mentioned in our testimony serves for just that purpose, because we're doing a lot of silo planning and talking, and the purpose of that committee is to bring us together so that we can plan. I also wanted to dovetail into the mission of the Department of Health Behavioral Health Division is to return persons to their home. That's how you even improve the services. While we are no longer the Department of Health under a decree, we know that BOC might still be, but our interdepartmental council allows us to help and to plan. Right now, those two structures are being rebuilt through the FEMA hazardous mitigation program. And so while we had two buildings, we now have one. And so our scope is to rebuild, be able to separate those two services, as well as build on St. Croix. So we're not absent of that mission to bring persons home. It's just a matter of getting those facilities in place and getting persons to man them.
Senator Carla Joseph, you're recognized for a point of information.
Thank you so much, Mr. Chairman. A pleasant good day to everyone and colleagues. This is a very critical conversation that we are having because we are looking at the least among us, people who are going through crisis and providing services timely. So my point of information is to Dr. Sims, and it goes along with your last comment because I read with intent your discussion in your testimony regarding the interagency or interdepartmental collaboration, and you said that's what they're supposed to be doing. Now, I saw in your testimony the collaboration, but it seems like it's only with education. What are the collaboration that's already taking place outside of education? Because I saw that. Because we have different entities here present today providing services and duplicate services. What does that collaboration look like that this interdepartmental collaboration team is supposed to be doing? Do you have a structure? How does that look?
I can say, and DC still can jump in, the Interdepartmental Council is designed based on any laws that we've had. The previous Behavioral Health Act, the new Act 8688, which is the roadmap or the tool for all of us to come together to deal with behavioral health, mental illness, as well as substance use disorder challenges. That meeting that is chaired actually by Deputy Commissioner Steele, and there's a subcommittee, is designed to assist us in the eagle eye planning that we can do and resources that we can share. It is unfortunate that none of us is adequately funded, and I feel like everyone in the room understands that. So that meeting allows us to deal with what do you have that we can use and vice versa. We are starting the meetings, kicking up the meetings. We haven't had 100% attendance, but we will make sure that everyone who's to be there is to be there. In the past, we've utilized actual resources, bodies between us. Lately, we've been trying to reconnect so we can do just that because everyone is working on a very skeletal personnel listing. DC Steele?
Mr. Chair?
Senator Carla Joseph still has the floor. Senator Joseph still has the floor. Proceed.
Mr. Malloy wanted to answer the question too, so that's why.
Okay, yes. Mr. Sims, Mr. Steele, you can answer, and then we'll have Mr. Malloy follow you.
Okay, thank you. So yeah, in that committee, we also developed a work plan. There's an actual work plan between the members. It was brought to the floor in the last meeting. It's going to be put up for approval coming up on this next meeting here in this month in June. And it was heavily focused on not only building out like our suicide campaign, we're building a robust suicide campaign around that. It talks about plugging in all the crisis supports and the access points within the different systems of care. So we do have a work plan that we're starting on. And then from there, the next step, like Dr. Sims mentioned, is to now put a matrix of those services in place to see exactly where each person fit in the interim.
Yes, Mr. Malloy, you can go ahead with your answer.
Good afternoon again. Ruben Malloy, Assistant Commissioner, Virgin Islands Department of Health. I wanted to add to Dr. Sims, Assistant Commissioner Sims' response about the Alger Shelterman facilities. That, as Dr. Sims indicated, those two buildings that are there are involved in the FEMA Public Assistance Program. FEMA determined that in spite of compelling evidence to the contrary, that they did not warrant prudent replacement. And they opted to repair the building, especially the annex, was severely damaged during the 2017 hurricanes. Those were one of the first projects that we submitted, and we are appealing that process. We've gone through the first stage of the appeal, and we will continue to appeal those facilities, number one. Number two, the $3 million that the legislature granted us, thank you very much, was used to fund and we have stated this in previous testimony, in previous sessions on this topic, used to fund the architectural and engineering firm to design the Anna's Hope facility. We were just presented with 4 design options to select. That facility is slated to be 40,000 square feet. That would mean if you take the current rate for construction, it's $1,000 per square feet. That would mean $40 million. And if you add 20 to 30% for furniture, fixtures, and equipment, that would add an additional $12 million. So that would mean that we would need $52 million to build an appropriately equipped facility to carry the needs. So, and then the new Donna M. Christensen building is slated to have 11,400 square feet of space dedicated to the behavioral health division, and that will include the clubhouse, 4 group rooms, 4 therapy rooms, 8 exam rooms, and 34 staff workstation and offices. And that is scheduled to be completed in early 2027.
Senator, this is Commissioner Encarnacion. Do you have, may I have a few moments, please? Senator Fonseca?
Yes, Senate Commissioner, proceed.
Thank you very much, and I really want to thank my team for being, is it doubled? Can you hear me double or? Okay, I'll continue. Wanted to thank my team for being there today, since I cannot be there, and commend them for the work that they're doing. One of the things I want to point out is, you have heard, we're building a foundation. Of course, we took 2.5 years away from what our goal was when we first started with COVID, which also impacted behavioral health in a significant way. I wanted to go back and say, yes, the foundation, the infrastructure is not just physical, but it's also looking at the foundation from an organizational standpoint. But also, I want to go back to the crisis intervention conversation. And once again, thanks Senator Capehart for putting the bill and for the Senate for passing that bill. Obviously, there are funding resources that's going to be needed in that bill, and of course, training and execution of the operations of the team. Our team actually right now are working diligently on creating that structure, the infrastructure that's needed, because there's going to have to be a site for that as well, because it's going to be linked to the 988. We're working closely with SAMHSA to ensure that the way that we foresee or we envision the crisis intervention team, once you call 988 and you have a crisis, you don't have to wait for us to refer you to someone else. That individual is going to be a clinician who's going to be working with you immediately and being ready to go on the road, whether it be St. Thomas, St. Croix, St. John, to be able to be there in your need. So I see the need, and I wanted to address that, the need for 24/7 access to care from a behavioral standpoint. Everyone's points are very taken. It takes a village to cure this. It's going to be a long road ahead, and just thank everyone for their input and what they're doing to curb or to decrease mental health challenges within the territory. Thank you for allowing me the time, Senator.
Yeah, and Commissioner, I just want to follow up on that, right? Because based on the information we got from Steele, with that, it can be as much as 1,100 per day. And then the information with Dr. Barragan, I know that Dr. Barragan is at Barbell, and they're also at Bureau of Corrections. And they're not at Bureau of Corrections?
No, Dr. San is the one that shares with Bureau of Corrections.
Okay, but they're at Elder Schulterbrand as well.
Yeah, Dr. Brannigan is Elder Schulterbrand.
So that means they're less than half time because there's a lot. Because like I said, the other organizations in the community also needs access to this psychiatrist because it's the same community. So Commissioner, I think what I would task you to do is to let the Committee on Health Hospital know specifically what are your needs for psychiatric services to cover the territory, because I can see where it is much cheaper to have a psychiatrist here than to send our people off island, those that are not, intensive.
Thank you. And while I was absent, I'm sure that the team spoke to you about the plan. We're also, we submitted a grant, and Director Giselle Ramos assisted with that as well, so that we can actually look to see how we can pull funding to pull more access or increase access to care. And I know that Federally Qualified Health Center, Frederickson Healthcare, spoke about Morehouse College. We're also working with them and to see how we can federally fund them to bring them down as well. So we're working on different aspects, and I think it's going to be successful once and let's pray that the grant is successful and we have the funding to be able to implement this. So
Yes.
Thank you for that.
Yes, and thank you. And then I got to congratulate you because that clinic that the Department of Health sponsored out at Eudora Ken, day before yesterday, and today, that is awesome. I was over there yesterday. They got 12 dentists, military dentists, doing everything for free. And they got all the equipment. They got about 7 optometrists. That's a big word. That's the eye doctor and thing over there doing all the services for free. That's awesome, Commissioner. I know you're busy, but you have a big hat. And so let's now fill the psychiatric needs, because I think we can do it. We've received testimony here that it's needed. Senator Milton Potter. Yes, go ahead.
If I could just let you know that Dr. Hunt just texted me about maybe an hour ago, and I approved for us to go ahead with next year's IRT, and the focus is going to be behavioral health, primary to everything else. Of course, we're going to continue to bring dental and optometry, which is, of course, the eyeglasses versus ophthalmology, which would be more examination. So we're going to be doing that again next year around the same time. So thank you for that.
Yes, blessings. Senator Milton Potter, you're recognized for your 7 minutes.
Thank you. Thank you very much, Mr. Chair. Good afternoon, colleagues. Special good afternoon to all of the behavioral health and health professionals and education professionals who've taken a chunk of time from their busy day to be here with us to discuss this very important issue, mental health and behavioral health in the U.S. Virgin Islands. I think the one thing that I see that I guess is a common theme that was consistently linking all of the testifiers here today is the concept that we are in a mental health crisis here in the Virgin Islands. That was consistently reiterated just across every single testifier who was before us today. I really believe that a lot of what we see on the streets of Charlotte Amalia, on the streets of Christiansted, on the streets of Frederickstead and Cruz Bay, a lot of what we see that looks like violence on the street is really a manifestation of a mental health, a complicated mental health crisis in our territory that is very challenging for us to address. It's complicated with the housing, affordable housing components, lack of facilities, lack of adequate outpatient and inpatient treatment facilities. So it further exacerbates a very challenging, space that we have here when it comes to mental health in our territory. I wanted to ask, really regarding we already have a challenging situation here in our territory with facilities. When it comes to our diverse population, you have a growing French Creole population, we have a growing Hispanic population. How do we assure that these already scarce services are reaching those underserved populations here in the territory? That we have culturally relevant providers who are addressing the unique cultural needs of the Hispanic population, the French Creole population in our territory.
So Nicole Cragwell-Sims, Assistant Commissioner, Department of Health. One of the first things the Department of Health does have a language line. So when persons call that are speaking different languages, they're able to get service. In terms of behavioral health, we are launching a suicide campaign. And that campaign is universal. Our goal is to provide information. A lot of times we operate in what I call the red zone, which is the discussions we're having now where persons are quote-unquote suffering, seeking medication, seeking assistance, seeking placement, etc. And we don't necessarily focus a lot of our efforts or energy on prevention. This campaign is designed to front-load a lot of information in various languages, and it's culturally sensitive. Even the talks about our private partnerships, they are sought from a culturally sensitive perspective. We even try to get psychiatrists and psychologists who are away to come back because we know of that connection. Persons who come into the culture are embraced at our services, but we are definitely utilizing this campaign to be able to provide information specifically from a preventative standpoint with the gamut of the fruit bowl, like the commissioner calls it, that is now influx into the territory.
So from a treatment standpoint, I respect that and I appreciate, that effort. But if someone were to come through the door at our public health facilities with a mental health challenge and speaks French Creole, do we have the capacity to really address that, to really help that client who has come through the door?
Yeah, great answer, Deputy Commissioner. As Dr. mentioned, we have some staff, some who speak some different languages, but if we don't, we use the language line. It's a call-in, and it translates in real time for us to see those individuals and then link them with the correct services.
Okay, thank you for that. With regards to
Senator, may I respond to that as well?
Yes, you can go ahead, Commissioner.
We have, I call it our little secret mission, and that is our community health workers. And so we have trained 60 or more community health workers. They're certified as community health workers, and of course speak varying languages. They're now across the continuum. So it's not just Department of Health, but they qualify as health centers, St. Croix, St. Thomas, FHC, as well as St. Thomas Eastern Clinic, and some of the nonprofits has been certified. They are going into the homes, into the communities, and speaking about social determinants of health, really determining what is the social determinants of health for that one person in that home, versus saying that we're looking at the community. We're looking at the person and we're looking at the community. So public health focuses on the person and a group of individuals, but as well as global health, we'll speak about the whole community on a whole. So we're doing it in different facets. But our community health workers speaking different languages going into the home will definitely tell us what our needs are and create the data that everyone is speaking about that we so need.
Thank you. Thank you for that. Eastern Medical Center, how do you address the issue of diverse populations in need of mental health or behavioral health services, like the French Creole population or the Hispanic population that is really growing here in our community?
Okay, like Paulette Vincent Potter.
Speaking to me.
Paulette Vincent Potter, Operations Manager at Behavioral at St. Thomas East End Medical Center. So like the Department of Health, we also utilize the language link that allows us to have the conversation in real time. And with that, we use the same trauma-informed care, and we are sensitive to their the needs specific to the different populations that we serve. And we try to communicate that as best as we can. You know, sometimes it's not always on point, I have to admit, because of, you know, the language link, but the language link that we use, but it's very helpful, and for the most part, it works, and that's the best thing that we have right now.
Thank you very much for your response. Mr. Chair, if I may just wrap up. Okay.
You may.
Thank you. And I don't know, Dr. Sims, I apologize if you explained the composition of the interdepartmental council. Did you? Like, what department, all the stakeholders, for example, these folks who are in this room, you know, who play a role in behavioral health in our territory, are they all a part of this council?
The interdepartment, Nicole Cragwell-Sims, Assistant Commissioner, Department of Health. The interdepartmental committee, yes. As I mentioned before, that committee is set up for all partners, you know, public, private, even persons who consume the services. Because, as DC Steele mentioned, it is a work plan-based committee. It's really geared to bringing all of our siloed operations together. So we definitely, when we leave here today, will ensure, but yes, it is open. We have selected, and it's everyone who touches behavioral and mental health services.
Excellent. Since you have the mic, just don't go too far. Next question is again for you.
Okay.
Regarding the nonviolent crisis intervention training, and I know the behavioral health bill speaks, I mean, it really gives you a whole lot of responsibility. I don't know how you do it, but you mentioned in your testimony that you've provided training on going to the police force. But I know there's also a big piece when it comes to the Department of Education and school personnel. Have you had the opportunity to embark on regular training when it comes to the Department of Education personnel, teachers, monitors, etc.?
Yes, absolutely. Thank you for the question. As mentioned in the testimony, our work is evidenced by being asked to come back and do 6 to 8 week training sessions. Our focus with the Department of Education, who has become our best friends and will remain that way, has really been from a standpoint of a peer-to-peer type of assistance. We know that we're small, but as we continue to train, and I must say that the Department of Health and the behavioral health teams are dynamic, as we continue to train, we're thinking of it as a ripple effect. So going out and training personnel, staff on first identifying psychosis, things of that nature, helps us to cut it at the knees. The monitors as well who interact with children daily, as well as the students, because everyone has to be understood, everyone has to understand what their parameters are, and so our trainings definitely will continue.
Okay. Thank you for that. And finally, the Eldridge Schultebrand Inpatient Facility. Do they have regular access to psychiatric services? Is that that's a Department of Health facility, right?
Yes, it is.
So I just want to get some clarification as to whether or not they had routine access or regular access to psychiatric services through the Department of Health, and how does that work?
Yes, Red and Steel. So that's the Dr. Brannigan that we were talking about when she's in the territory for 2 weeks out of the month. She makes sure to stop by ESF, but she's also on call with ESF at all times. So she works closely with our head nurse, Miss Nurse Barron, there, and makes sure all the patients' care is being taken care of.
Okay. So is it realistic to really meet the comprehensive needs with that arrangement of
we can always utilize much more services. I mean, ideally, we would love if that facility had their own psychiatrist to operate there on a full-time basis. And I do want to stress that Dr. Brannigan is a Virgin Islander who came back to work with us.
Awesome. What is the key to recruiting and retaining qualified psychiatric services in the territory?
Psychiatrists is in a shortage on a whole national level. And so I don't want to make it appear that they're just readily available and we're all struggling. It's a major crisis across the whole territory, but it would make certain that we have to pay them accordingly because we're asking you to come down and then the cost of living is higher for most of them. And compared to what they can make in the mainland, private practice, contracting, etc., it's a huge salary to really make someone recruit. Or you get someone who's at the later stages of their career, kind of want to slow down a bit and maybe don't want the constant hustle of a psychiatric hospital or something like that.
Yeah. Thank you for your response. I know that I'm an NFL fan. I like to watch football. I know the price of or the cost of a quarterback now is like $50 million per year. That's just the reality. So even the poorest teams know that if they really want to have a chance of winning, they have to find a way to, I don't know, you cut from someplace, but you have to find a way to pay. So I really think that, and it's a collaborative thing between our hospitals, between you, between this body and the executive branch. We need to find a way to find the funding and to make this a priority because a lot is at stake here in our territory. So thank you very much. Thank you very much for your leniency, Mr. Chair.
Thank you, Senator Potter. I was just here sitting to myself, I think I get to gain that group one day because I know we have the senator for Savan, his wife to come down and he to question her. Now Senator Potter has joined the ranks. I hope there's no repercussions later on. Okay, next we'll go to Senator Maurice James. You're recognized for your 7 minutes.
Thank you, Mr. Chair. Good afternoon, Virgin Islands. Good afternoon, colleagues. Good afternoon, testifiers. Long day. And Mr. Chair, I believe that the colleague before me, my birthday twin, did a double 7 minutes. So I hope you'll be lenient with me like that. I want to first focus on education. The Department of Education, they've been sitting there for a long time without anyone asking them any questions. And that's where I am going to focus, right? So in your testimony, everyone today and all of us, we admit we know there's a mental health crisis in the territory. And we have to come up with solutions. The one thing that the Virgin Islands Department of Education said in their testimony that is so true is that we are all faces of mental stress. That was perhaps like the deepest statement today. Every single one of us are faces of mental stress, all that we've been through in the last years. And that it's just a one thing that could trigger an episode. And so that's my concern for our children, because we love to say that our children are resilient. We love to say that. And in fact, we see children coming every day with a load, a bag coming to school. When I looked at the testimony from the Department of Education, I did not see what I wanted to see, which is I want data. You have a lot of statements about services to students as identified by school teams or the court system. Assistance is sought either publicly or privately to cater to the individual need. I underline all these very nice sentences, but they don't tell me anything really. You refer, there's individual and group sessions, Department of Health, and the Department of Health just talked about their great partnership with you. But I want to know, I want data. That's what I want. I want to know how many students And by the way, in preparing for this, I was ready for the experts today. Things I didn't know, that there's something, you could categorize mental illness like any mental illness, AMI, and then severe mental illness, SMI, things that I didn't know. Any mental disorder. So I'm focusing on adolescents and our children. Do you have data on, for example, how many children in the school system are, well, let me backtrack. First question is, how many psychologists do we have in our schools? I don't know who can answer that question, if St. Croix or St. Thomas.
Good afternoon, Senator, if I may.
Go ahead.
Victor Sum III, Assistant Commissioner of Education. Unfortunately, we do not have school psychologists in schools. We have school psychologists within our special education division, and we also have school psychologists, at least one, in our alternative education programs. Our school psychologists provide services that relate to the identification and evaluation of students with special needs if they are referred to the special education program, and Director Lockhart is there and she can provide a more detailed description of what their job is. Our school psychologist at the alternative education program in St. Croix, she not only completes the functional behavioral assessments, which is an evaluation, but she also provides one-on-one services. It is our hope, it is our prayer that at some point not only can we have a pool of school psychologists that can be, visit schools, but also have some clinical social workers. Those are fields that.
Okay, but we gonna get down to we get it down to what I need to know. If we have children in our schools, you don't have school psychologists, but you do referrals. Well, you said that Ms. Lockhart can help me out here, right? So let's have this conversation about our children. Recognize the mic of Ms. Lockhart here on St. Croix. Is it Dr. Lockhart? Dr. Lockhart, thank you.
Good afternoon, Dr. Tanya Lockhart. I'm the district director for the Division of Special Education. So we do have school psychologists. We have 6 of them on board. Not only are they on board, we also have the licensed social workers. Okay. So with those individuals, they do give emotional support, coping strategies, and also create an intervention plan for our students.
Okay. Well, you probably haven't seen this, but we received testimony from Dr. Marshall's Consulting Services, LLC. So I'm trying to tie this in and ask you this. One of her statements, she's not here, so I'm going to read. She says, individuals who normally seek my services are parents with children with behavioral and emotional disorders who require professional psychological services. So would you, the Department of Education, be referring these children, and are you keeping data on these children?
We'll keep data, but however, the severity of these cases or these behavioral issues, we will refer these students to the Department of Health for further testing.
So that's where the Department of Health comes in?
Yes.
Okay, so she said, and this is important, in what she submitted to us, she said 40% of patients struggle with depressive disorders, 20% with anxiety disorders, 15% with trauma and stressor-related problems, 10% neurodevelopment disorders, 10% schizophrenia spectrum and bipolar-related disorders, and 5% with other behavioral and mental health disorders. And I wanted to find out, not necessarily from the Department of Education alone, but I wanted to see testimony like this, where you provided data on the prevalence of any mental illness in the population and who received in the last year services for severe or mental, which agency among you can I get that information from? You see how this is broken down, like how many people in a territory suffer from going from depressive disorders to schizophrenia spectrum, behavioral. Who can I get that information from? Because we're talking about mental health, but we're talking about it just by saying, okay, I see somebody on the street. I know people coming in. The Women's Coalition gave 9 cases of people who, based on the Women's Coalition interaction with them, are suffering from some mental illness. How do we justify funding, training? We know all of that, but how do we plan effectively if we don't have data on specific illnesses in the Virgin Islands? Anyone? Department of Education, no, not Department of Education, sorry, that wouldn't be you. It would be Department of Health, actually. Department of Health, can you help me out with that?
We do have Nicole Cragwell-Sims, Assistant Commissioner, Department of Health. We do have record keeping in the department. Every service is accounted for, so there is data. It is divisional based and Department of Health based.
Through the chair, I want data on how many adults age 18 or older receive mental health services in the Virgin Islands. How many females versus males receive services? How many adults, young adults, 18 to 25 years old? How many adults, 26 to 49 years old? And how many adults, 50 and older, received services, including virtual services, for mental health illness in a territory? Through the chair, I would like that information. Yes. The prevalence of any mental illness in the Virgin Islands, because when it comes to the Department of Education, they need to know specifically how their children, what their children are dealing with when they go to school. So, Mr. Chair, I guess my time has called, but I do want to say this, right? I need that information.
You can wrap up your question.
I'm going to wrap up. I want to say to the Department of Health, I've been going down to the St. Croix complex. Your fare is excellent. But when I visited yesterday, one of the officers from Off Island who's participating in it said that the most wonderful thing about the population of, St. Croix, because they're here on St. Croix, is that the people who come are well aware of the issues they have. Our population is well educated as to the issues they have. The problem is access. And it is wonderful that the Department of Health is providing this wellness clinic, but it shows the need that we have. And I recently read an article because Women's Coalition, the St. Croix Foundation touched on poverty. And I recently read an article that said most people die from end-stage poverty, meaning they cannot afford to get the health services they need. End-stage poverty. I'd never seen it. The writer was right. That's what we're seeing in the Virgin Islands. So I do not want our children to suffer, and I want to commend the Department of Education for doing what they can. But training and group sessions don't deal with that one child that's sitting in that group session that may need that individualized care and treatment. So thank you for your answers.
May I add?
Thank you, Mr. Chair.
Mr. Chair, may I add just one thing?
Yes, but one clarification. So, Senator James, so you want the statistics on the males, 50 and over, and females, and then you want the kids 12 to 25, the statistics. And was that Department of Health or Mental Health Division going to provide it? Who is going to provide that data? AC Sims?
Mr. Chair?
Yes.
I'll go over it again. I want adolescents, which is adolescents, I think, would be under 18, right?
Yes, I think
And
so.
then I want adults age 18 to 25. I'm breaking them down into groups. Young adults 18 to 25, adults 26 to 49, adults 50 and older, and then I would like it broken down just generally between females and males, and who've received mental health services in the Virgin Islands in the past year, including virtual services. And so, for example, I would think that the 9 examples that the Women's Coalition identified, those cases, I'm hopeful that they were also, the Department of Health was involved in assisting with these 9 people who clearly have issues, and that the Department of Health is capturing these 9 clients who sought services at Women's Coalition. Because then we're not working together as a community. And I believe someone said about all of us working together as a community. So we need to find a way to give me the numbers. Thank you.
Thank you, Senator James. Quickly, I want to talk some numbers, because I know the last time the legislature met in session, we had before us where Wang Louis, CEO Cook, had indicated that you had owed WAPA about $2,026,000 more or less, and Roy Snyder was $3,617,000 more or less. And the legislature had acted, but the governor vetoed it. So, since WAPA is always on our mind and the legislature had acted, I wanted to know if Wang Louis still has that outstanding accounts payable to WAPA, and also Roy Lester Snyder. And also Tina Commission had mentioned that the Department of Health had owed you $263,000 more or less for space. So what's the outcome? What's the status, Doug Cook? Do you still owe WAPA CEO Cook, do you still owe WAPA electricity bill money?
Good afternoon, Senator Doug Cook, CEO for JFL. Our outstanding balance had been cleared down to 0, so our balance, any balance that we have would be at current month's behind.
Oh, great. So all your WAPA bills have been paid. Well, I think Tina Commission stepped out. But let me go to Eldra Schulterbrand. I got a question, Ms. Commissioner Sims. Okay, we have about 26 patients, residents at Eldra Schulterbrand?
Yes, sir, 25.
25. Okay, so being that this is my understanding, correct me if I'm wrong, being that they are basically wards of the Department of Health, right? So that means that for the services that we provide them, the medicine, the food, room and board, et cetera, that means that the government has the right to collect any income they have, like Social Security and all of that?
So I'm actually going to kick it over to Nurse Barron, who I believe is online. I would say that the Department of Health has been working very closely with the patients, their families, to develop policies that will allow us to pay moving forward, but I'll have Nurse Barron explain.
Nurse Barron, so my question is I need to know if we are receiving the Social Security and other income from the residents that we have at Eldra Schulterbrand, being that They are under 100% care of the government. And also those account balances and what's the procedure. Nurse Barron, are you there online? Media? No, can you recognize?
I'm here.
Okay, yes, proceed, Nurse Barron.
Good afternoon, and thank you for the opportunity to speak on behalf of Shelter Brand. Yes, a handful of our residents receive Social Security. There is a policy, a billing policy in place that was mandated by Judge Watlington. And so 80% of whatever the client receives goes to the department. So it's a monthly bill. It's not enough for the services that we provide because we take very good care of our residents. But she wanted part of that to go towards the care. So,
Nurse Barron, can you speak a little bit louder into the mic? The stenographer is having a little difficulty with your testimony.
Okay, I was saying that there are a handful of patients who receive Social Security. And at the moment, there is a billing policy in place that was mandated by the Honorable Judge Watlington. It began in September of 2019. And so our billing the residents for the care that they're receiving. And it's not adequate, but we're taking 80% of their Social Security. So whatever they receive, we take 80% of that. And it goes towards the department, to the Department of Health. And the rest of that money is for the medications, for whatever personal effects that they need. So we do bill them.
Thank you, Nurse Barron. And for the community, don't take the mic, don't take the video off of Nurse Barron. I want the community to see a real hero in the mental health industry. This is Nurse Alex Barron. She's been a mental health nurse for, I think it's 41 years. She has more than done her duty. In addition to that, now she's the big nurse. She's the head nurse out at Childebrand. But her experience, right, goes back to when the mental health ward was in the Nod Hansen Hospital. She was also, when there was Michelle Motel, we hear about Michelle Motel need to knock it down. Barron was a nurse there at Michelle Motel, and now she's a nurse out at Childebrand. So, Barron, give me a little comparison as to the state of mental health now in 2024 as how it was when mental health was in Nod Hansen Hospital, because most people don't even know that mental health used to be in Nod Hansen Hospital.
Well, long-term care is now called Shelterbrand, opened its doors in 1983 to receive residents from St. Elizabeth Hospital who were coming back home. And so we were at the back of New Hampton, behind God's back, in asbestos. So they moved us to Michelle Motel. I don't know if that was better, but they moved us there, and we passed Hurricane Marilyn there, and it was a disaster. Then we moved to where we are now. So I've said that before, we are in a better place. We really are in a better place because nobody knew we existed. We were not able to get medications in Michelle Motel. Now we have no trouble. We just send the prescription to the pharmacy and we get our medications. So things, we have moved on up and we are in a better place. And may I add to the psychiatrist piece, we have Dr. Brannigan, who is wonderful. Although part-time, we can reach her by phone, text, email, virtual. She comes once a month. And I think that is sufficient for us because our clients are chronic. They are chronic, they are chronically mentally ill patients. And so we do not need a psychiatrist every day. If we have a need, we call her, she responds quickly. And so I I love that piece of what she's doing for us. So that's what I have to say about doctors. We have. Should I continue about Shelter Grant? I
Yes,
just
go
want
ahead.
everybody to know what we do at Shelter Grant, that we take care of the patients. We have various diagnoses there, schizophrenia, schizoaffective disorder, bipolar, but mostly our clients have a lot of medical issues. And to create equilibrium, a balance, we have to take care of both the medical piece and the psychiatric piece. And since many of the clients are aging in place, like me, we have a lot of issues there, and we take care of every single one. Every single patient has a need, and we take care of every single need. Medical, psychiatric. We now have a licensed therapist for Shelter Grant. So we have individual therapy, we have group therapy as well, and other things that we do for our clients to keep them, we take care of the entire patient, spiritual needs, everything we do for our patients at Shelter Grant.
Yes, and thank you, Nurse Barron. 41 years with the government and continue serving, that's admirable. And also I wanted the community to know that since Nurse Barron have 41 years, the psychiatric nurses is a very, very good career. In addition to that, you do get hazardous pay because, it's a psychiatric nurse is dangerous because, like Dr. McCormick was saying, if they come off the medication, I don't know, there's a big fancy word you call it, but I know that you're even taking your medication and you're liable to act up again. Your lives and all of the other nurses out there in the Shelter Grant facility really risk your life every day. So we thank you very much for your service.
I want to thank the staff because I can't do it by myself. I want to thank all my staff. I don't have to be there for things to go on. And so I want to thank them for helping me to make Shelter Grant the only facility of its kind in the Virgin Islands, to make Shelter Grant what it is, to care for the residents. And may I say, we do housing for them. We find housing. There are 2 residents who are about to leave in their own apartment. As was said before, the goal is to get them back into the community. Not everybody can go back. But those who can go back, we get housing for them. We get jobs for them. As I speak with you now, there are 3 residents who are employed, who go to work and they pay the taxes, and they file the taxes at the end of the year like all of us. And so I just wanted to put that out.
Well, thank you very much. And, we can see from the background of the picture that, you become a psychiatric nurse for 41 years. You get a nice house with them nice 3x8 rafters in the roof and things. So that's good. We're glad you're doing well. And it's always so nice to see you. Yes. Thank you very much. Tina Commission from Wang Snyder. There was a question on the floor. The last time the legislature had looked at the WAPA issue, Roy Lester Snyder Hospital had a bill for WAPA, and we want to know what's the status, what's your balance with WAPA right now?
Yes, Senator Fonseca. My sense is that balance has been resolved through the central government working directly on our behalf, which we appreciate with WAPA, but I will get that confirmation at the 100% level and let you know. Thanks.
You mean resolved, meaning that it's zero now other than the current month?
I do believe so. That's my sense, but I have not seen the statement, so let me verify, and I'll be happy to get that information back to you.
Okay, thank you very much. Next, we'll have the Honorable Legislative Secretary, Senator Carla Joseph. You're recognized for your 7 minutes.
Thank you so kindly, Mr. Chairman. A pleasant good afternoon. We have been at this very critical discussion and topic for the majority of the day. I wanted to again commend everyone who is here and who made time to carve out your time and also present your testimony to the committee for us to digest and also have a discussion relative to how we are working and looking and taking action regarding the mental health crisis in our community. Now, I had some questions here for one AC Sims from the Department of Health and Commissioner Avril George. I want to commend you, Commissioner George. Much success on your tenure as the Department of Human Services Commissioner. Now, my question is, I know, AC Sims, you mentioned that the consent decree for the mental health has been addressed. It's no longer hanging over because that was done years ago.
Yes.
And as far as the 5-year plan, strategic plan that was completed, this was a very thorough assessment, and I believe Dr. McCormick mentioned it, that also is no longer being utilized, that 5-year plan.
Nicole Cragwell-Sims, Assistant Commissioner, Department of Health. So yes, to the first part of your question, it's no longer over. The 5-year plan, however, is being updated. It came out 2024, 5 years ago. So it had been utilized. The information that was in there, the goals that was set, is now being updated for a future 5 years. So it's not a plan that we've eliminated.
So does the department, well, the Division of Mental Health, do you now have a strategic 5-year plan in place and that has been approved by your oversight federal agency?
We are at the approval stage.
You're at the approval, so you have already submitted it?
No, we're at the submission for the approval stage. Yes, it had to be updated for the future 5 years.
Okay, and what is your timeline to have that completed to send to your cognizant agency? Who is your cognizant agency? I'm presuming is the Department of Health and Human Services.
Yeah, so we work closely with Health and Human Services, SAMHSA, HRSA. In terms of the submission for approval, we are still working on that. It will be tightened and sent out for approval, but territory-wide, it has to go through those levels of approval as well.
Okay, but do you have, I know when you're working for these, and I'm trying to get it from you, extrapolate it from you, a date. That's me, that's my project management hat wearing, because if you don't have that date, then it just there arbitrarily, we're working on it. So do you have a fixed date? Your department has a fixed date to complete it and send it to SAMHSA?
So we're looking at when I say 3 to 5 month time frame.
Okay, so we're saying by the end of the year?
By the end of the year, yes.
Okay,
yes.
So by December 31st, 2024, you should have already, you would submit it?
Correct.
Okay, good. I just wanted to get some time frame from you. Now, I also wanted to ask you, Dr. Sims, and most of my questions are geared towards your agency, your department, because you really are at the helm of the mental health issue and providing that service to those who are in critical need of it. On page 4 of your testimony, you cited that the national 988 Lifeline received 492 calls that originated from the territory between November 2023 and March 2024. Is there a referral system you have or any coordination to refer those individuals to the services that they need here locally? Do you have any collaboration or communication with the National 988 Lifeline?
So at the moment, we do not have a referral system. What we're working on now is to try to get a local call system that will be in place by 2025. So at this time, we're utilizing the national services, not on a referral basis, but whatever that service is providing nationally for persons calling in.
Okay, so my concern is if a person is calling in and it's a teenager calling in and they say they're going to shoot themselves or they're going to go to a school and they want to do something harmful not only to themselves or to the school, especially the teachers there. And I've had complaints, concerns from educators who have said that. How do we identify those individuals and provide the crisis intervention to that individual when they call this number, this Lifeline 988 number? How is that done? Can you tell us, is that being done?
So what's happening right now is because the number is being reported nationally to us, so we know the number of calls. There's no direct pipeline right now to persons calling nationally. It will come about when the local service is provided. What is happening right now, however, is our services are being directly utilized through places like education, private calls, etc. So if there are any children, adolescents, any person in crisis, specifically with any suicidal ideations, then they call directly and the team is engaged.
Okay, but if they call this number...
May I add to that? This is
certainly, Commissioner Encarnacion, you may.
Thank you. We've actually had incidents in the close future, in the close past, that spoke to individuals who were about to commit suicide, and what they do is they link with VIPD because that would be their link to 911. Since we do not have the local crisis team as well as yet, and then that way we've actually implement action. And so we've done that a couple of times where we've nationally contact our VIPD or our National Guard. That happens, and then we take action after that. So it's not a lapse in time in where we have to intervene.
Thank you for that clarity, because I know there has to be, especially with that level of communication, and especially when it's a crisis with a young person and they want to harm themselves and then extend that harm perhaps to others. They may have that level of collaboration. Mr. Chairman, I heard that my time has been called, but I have just two more pressing questions.
Yes, you may.
Thank you so kindly. Now, I wanted to ask the plan for, and this was in that strategic plan, it called for a mental health policy task force. Is there a mental health policy task force in place? Commissioner Encarnacion or Commissioner George, can you tell me if there is?
I can start with that by saying that the Interdepartmental Council or committee that was part of the act, it fits the bill for a policy-driven task force, so that's where we're going with it right now.
Okay, good. Okay, so you're still in the planning stages with that. Then I wanted to ask Nurse Barron, because I didn't get Nurse Barron. Are you still there with us virtually?
Media, is Nurse Barron still connected on Teams?
Yes.
Yes, wonderful. Nurse Barron, you're doing a champion job out there at the Eldra Schulter-Brand facility. I want to say major kudos to you and your team. They are very, very compassionate and on target and work as a full team. Now, how many beds do you have totally at your facility? I wasn't able to glean that information. How many beds do you have available to serve the population?
Available beds.
Well, total amount of beds, and how many beds you have?
The capacity, the capacity is 32.
32. And currently, how many are filled?
We have 14 males and 11 ladies. But we are expecting...
that's 25 you have right now. 14 males and 11 females?
Mm-hmm.
Okay.
But we're expecting court order patients, 2 males coming in next week. So the male beds are taken. We expect one female soon, and we have hospital beds. 2 rooms have hospital beds. So it doesn't mean that because we have 25 that there is space for 7 people.
So you're looking go ahead. I'm sorry, Nurse Barron.
The male side is taken. We have 2 clients coming in. We have 14 males, 2 clients are coming in, so that will be 60. So that's filled. The ladies section, there are 11 patients there. There is 1 room that holds a hospital bed, so we can't put anybody in there. There's not enough space. And so, so that's how many. And then we expect a patient.
I counted a total of 28 with those that you added. And so that would leave you with about 4 vacant beds that you...
Yeah, beds.
So you have 4 vacant. Is there a discussion relative to bringing home, or do we have the capacity to bring home some of those individuals who are housed off island, at least 4, to relocate them to the Eldra Schulterbrand so we could be saving some money? Especially knowing that one moment, Nurse Barron, especially knowing that Nurse Barron has represented that she has, I think it's 2 of your current clients who are going to be discharged favorably, and you have done a yeoman's job, Herculean job in finding them a home and placing them in jobs, which I think is terrific. I don't know of many facilities that do that, mental health facilities that do that. So that's a question for our health partners who are here. Is there any consideration in doing that so that we could bring some of those funding home instead of having it going off island? That's our tax money. And I will close with that, Mr. Chairman. Thank you kindly.
Nicole Cragwell-Sims, Assistant Commissioner. Yes, Senator, our intention is to return as many patients home as possible. What we do is look at patients on a case-by-case basis to see how they fit into the facility, and that's being worked on right now.
And I agree with that, yes.
Thank
you. Yes.
Thank you. Thank you.
Media recognize a mic for Senator Carla Joseph.
Thank you so kindly. I just wanted to know, finally, Mr. Chairman, I know that was my final question, but I understand that that's being worked on. You know, when things are being worked on, you should have some kind of outcome, and I'm hoping that you have already started to look at that, and you have identified at least 2 persons that we can relocate back home and start that transition back into the world, you know, and make sure that they have the follow-up. Thank you so kindly, Mr. Chairman, and thank you, Department of Health and everyone here for all the work you do. Thank you.
Thank you,
Chairman, if I may. Chairman?
Yes, Commissioner, go ahead.
I wanted to remind Senator Joseph may not have been in the room when we spoke about 2 individuals coming back home outside of the territory into Elder Schulterbrand. So it's not just a plan, but it's an action as well. And so we continue to do that. We brought several back home, as well as Ms. Barron has indicated, we're now sending 2 individuals back into their homes, which would allow 2 other individuals to come in. So it's actually in process.
Okay, thank you, Commissioner Encarnacion. The committee will stand in recess for 2 minutes. The Committee on Health, Hospital, and Human Services is back on the record. Colleagues, I think we've exhausted our line of questioning today, so what we're going to do now is we'll allow the testifiers to have a 30-second closeout. And what we'll do is we'll start with Ms. Lewis on St. Croix, and then we'll go to Frederickstead Health Center, and then we'll have the Commissioner Averill George for Human Services, and we'll come over on St. Thomas. We'll start with Nana Baby, and we'll go. So, Ms. Lewis, Dr. Lewis, you may proceed with your 30-second close.
Okay, thank you. Good afternoon again. My name is Dr. Clemma Lewis. I'm the Executive Director of the Women's Coalition of St. Croix. What I would like to leave Senator Fonseca for the committee and for the rest of the senators, I have two concerns. With the information I brought, I'm left with who helps the nonprofit that's doing the work. Who do I call for my vandalism? Who do I call with the schizophrenic? Who do we call when we need help? I do pay for some private psychologists, psychiatrists with money I get from LEPC. So I want to throw that out. I hear about all these teams and meetings, but I'm not a part of that. That's one. And number two, I would like to say, because it wouldn't be Clement if I didn't, what about the protection of the community? Because doing this work, we're threatened. We know I know a gentleman that was killed at the cemetery just trying to take flowers to his wife. So who protects the community from those that have mental disabilities? I don't know what's in place. We don't have anyone to call. And yes, we're all here to put services and protect the vulnerable, but we also need to come with who's going to protect those that's working with them and who's protecting the family, because I also got family members that's being injured by people with mental disabilities. So I see those as two outstanding issues. Thank you very much for inviting us, and I am always open to collaborate and work with whoever wants to work with us. Thank you for inviting me.
Thank you, Dr. Clement George. Commissioner Averill George, Human Services, you may proceed.
Commissioner Averill George, thanks for the opportunity to testify on such an important subject in our community. DHS stands ready and committed to joining force with every entity, in addition to Department of Health, to improve the health and well-being of our citizens and the people of the Virgin Islands. Thank you.
Thank you, Commissioner George. And next we'll proceed with Ms. Haston, Nana Baby Care. Please recognize the mic of Senator Frankie Johnson.
Testing. Thank you. Good afternoon. My name is Darian Harrison. I'm the director for Nana Baby Children's Home. I just want to say thank you for having me here today to be part of this discussion. And I just want to urge the committee to remember that we have a very new and pressing need for our children aged 13 to 18, as there is now no placement option for them on the island of St. Thomas. Nana Baby Children's Home is working on seeing what we can do to accommodate a second facility where they can be housed outside of the 0 to 12 unit. But it's going to take a lot of community support and funding. So it's a new need, but I'm going to keep talking about it until we can find a spot for those kids so they can continue receiving support. Thank you.
Thank you. And we'll go back to St. Croix because I think I see Ms. Webster back in the well. Ms. Webster, you can proceed with your 30-second close.
Good afternoon. I just would like to take the opportunity to say thank you on behalf of the staff, the board of directors, and the patients we serve for the opportunity to speak here today on such a crucial topic. We're definitely looking forward to continue to work with our partners, both in the Virgin Islands government as well as the other community-based organizations, to try and improve the services to those with mental health challenges. Thank you and have a good day.
Yes, thank you, Director Webster, and I'm looking forward to seeing you on St. Croix. I think we meet next Friday, next Thursday, so I'm looking forward to meeting with you in person. Thursday, we have some important issues. Okay, next we'll go to East End Medical Center, Mrs. Potter.
Good afternoon again. I'm Paulette Vincent Potter, Behavioral Health Operations Manager at St. Thomas East End Medical Center. I just want to say thank you for inviting St. Thomas East End Medical Center to be a part of this very important conversation. This conversation just reminded us of how grave this situation is, and that the work we have to do is very, very important. I believe that we will be better off if we work together. So though we're small at the Behavioral Health Center at St. Thomas East End Medical Center, I would like everyone here to remember us and to know that we need you, and that we need you to help us to help others. So let's work together as a team and do the best we can for all of our patients and the people we serve. Thank you so much.
Thank you, Ms. Potter. And then we'll have Ms. Anya Stewart. You may proceed with your closing.
Is it still afternoon or evening? Outside is dark. Okay, I'm Anya Stewart, Family Resource Center, and on behalf of our board and Team FRC, I say thank you for inviting us. So we had this opportunity to meet with other organizations, and we are open to collaborate to make a dent in this situation, this dire situation we have in the Virgin Islands. I know together we can make it happen. So let's work together and stay focused, and things will get better. It will. And we have to remember to put God first in everything that we do. Thank you.
Yes, definitely, all the time, always, all the time.
He's good all the time.
Yes, and Dr. Lori McCormick will have your 30-second brief closing remarks. You may proceed.
So I'm Dr. Lori McCormick, board-certified psychiatrist and family physician in private practice. I'm just here half-time right now. I was displaced after the hurricanes in 2017. And I think this has brought a lot of light to the need in the community. And there is, I just want to reiterate that pot of money that's going off island and our people. And I love that there's a plan in place to start bringing people back. I still feel that there would be quite a need to make sure that we have at least a full-time staff psychiatrist at the Community Mental Health Center to be that central cog in the wheel to keep track of all of the severely mentally ill, which is, again, roughly 3,000. And so, the fact that there's psychiatrists now at the Roy Lester Snyder Hospital on the outpatient basis is great. There's quite a big need for people with mental illness that isn't necessarily in that severe category. So thank you.
Thank you. Yes, thank you very much. Next, we'll have Tina Commission from Roy Lester Snyder Hospital.
Good afternoon again. Tina Comas-Young, CEO for Schneider Regional. On behalf of the entire team at Schneider Regional, I want to thank you, Senator Fonseca, and the entire committee for allowing us the opportunity to testify today on behavioral health and on the wonderful care that we provide at Schneider Regional. I want to say a special thank you to our entire team at Schneider Regional, especially the wonderful professionals on our behavioral health unit, our very talented ER team, and our folks that support our wellness clinic. We're going to continue to work with all the partners that are here testifying today and with others in the community that provide this care, and just keep doing our best to serve the community. So thank you once again, and thank you to our entire team at Schneider Regional.
Thank you, CEO Commission. We'll have Dr. Jorgen from Education, and your message that you gave to all those graduates. How it went. If you think you can, you can. If you think you can't, you can. You can proceed with your closing remarks.
That's correct. Thank you for having, but I yield to ACSO as the senior member of the department.
Okay, yes.
Thank you, Dr. Jorgen. Victor Som, Assistant Commissioner of Education. I want to thank you, Senator Fonseca. This was a very good start, and I pray that it doesn't end here. There is so much to do, especially as we look at our young people and the trauma that they've gone through with COVID, with the hurricanes, and much, much more. So I pray that it doesn't end here. I'd also like to thank our wonderful partners of the Department of Health. We are tied to the hip, and we look forward to additional work with them. And lastly, one of the factors or one of the components that I need to really praise is our school counselors. They work tirelessly to support our students, not only in the academic realm, but also with their social, emotional. So a big up to all of the counselors, school counselors within the Virgin Islands Department of Education. Thank you very much, Senator.
Thank you, AC Soms. And then last, we'll close out with Commissioner Encarnacion. Your closing remarks.
Thank you, and I'd also like to share it with Dr. Sims as I'm finishing, but I wanted to say thank you, Senator, for allowing us to have this discussion today. We heard, we listened, and of course, we have to go back and also address some of the questions that came up. The gap analysis that was done, completed by DC Steele as well as his team shows actually that we recognize a lot of the things that were said today. Plans need to be put in place and actions need to be taken, and those things will be done. And like I said before, we have to lay the groundwork, and it has to be a very strong, cemented groundwork so we can expand our services. I have to say that I want to commend Nana Baby for the work that they're doing, because adolescence care is one of the things that we've been struggling with. So that's something that's there. I have to also commend the conversation that was had by the St. Thomas St. Clinic and Mrs. Vincent Potter, as well as the Family Resource Center, and the way that they presented the need for us to work collaboratively and what we can do to gain the future. So DC Steele has already said to me that those individuals and anyone who really wants to be a part of it, we can invite you to the council that is actually being it's a subcommittee of the interagency committee. So that council is something that we can actually invite you to, so that you can have a voice at the table. And like AC Sum just indicated, it cannot stop here. It has to continue. We need the support from Governor Bryan, which we have, because he has always put behavioral health as his top priority, as well as the 35th legislature and you, Senator. So thank you all for what you've done. And I would really like to give AC Sims an opportunity to say something.
Yes, AC Sims. Media, please recognize the mics of all the testifiers.
Thank you so much. I just wanted to remind everyone that mental health is not a destination, but it is a process. It is not the drive to where you're going, but the actual process of that. It is not a fixed state, so none of us can afford to be in a fixed state. I just want to also remind everyone to take care of yourselves and each other. Thank you.
Thank you, thank you. And in closing, I would like to express my sincere gratitude and thanks to everyone here today for providing your invaluable testimony to the Committee on Health, Hospital, and Human Services. I'd also like to thank the Legislative Central staff, my staff, and everyone in the viewing and listening audiences as we continue to advocate for the improvement of the behavioral health and substance abuse issues in our territory. Your tireless efforts to address our complex behavioral health challenges within the territory are commendable. And I'd like to reiterate that mental health is health, and that together we can and will end the stigma of mental illness. And together we should strive to foster mental wellness and a more resilient future for all residents of our beloved Virgin Islands. May God bless you, and may God continue to bless the Virgin Islands. Blessings, and have a good evening. The Committee on Health, Hospitals, and Human Services is hereby adjourned.